Good afternoon. Just a courtesy announcement that we're going to go live on the web and on YouTube. Thank you.
Good afternoon, Tony. Would you like to do a mic check? Tony?
Hi, Supervisor Ellenberg.
Hi, Frank. How are you doing?
Good. How are you?
Good, thank you.
I believe we're still waiting for Supervisor Wasserman.
Yep, it's 1:57. My guess is he will not be late.
Okay.
Good afternoon, Matthew. Would you like to do a mic check?
Matthew Fisk, present. Good afternoon.
Thank you. Good afternoon, Sylvia. Would you like to do a mic check? Oh, she's still connecting. Hi, Sylvia. Would you like to do a mic check? Oh, you're muted, but I think.
Can you hear me?
There you go. Thank you.
Hi, everyone.
Hey, Sylvia.
Hi.
Michael, would you like to do a mic check?
Good afternoon, Michael Chinaco.
Thank you. Good afternoon, Supervisor Wasserman.
Good afternoon, and Madam Chair.
Can hear you. Thank you.
And good afternoon, Mr. Vice Chair. Told Frank you'd be on time. 1:59. I will call the meeting to order at 2 o'clock promptly.
Thank you.
All right, Frank and Jill, are we ready to go from your end?
We're ready.
All right, then with that, I will call to order this month's meeting of the Public Safety and Justice Committee on August 6th, 2020, and ask the clerk to do a roll call, please.
Vice Chairperson Wasserman,
Here.
Chairperson Ellenberg,
I'm here.
you have a quorum.
Thank you so much. With that, let's just get right into public comment. Please, do we have speakers today?
We have three speakers at the moment.
Great. So let's provide them with 3 minutes and invite the first one to begin.
Great. The next speaker is Scott Largent. I am unmuting you. Please accept the unmute and you'll have 3 minutes to speak. The timer will start when you begin speaking.
Great. Good afternoon, everyone. Scott Largent. I am across town right now. I'm over near the Mexican Heritage Plaza, the elementary school. I believe it's San Antonio Elementary School. And I came over here to get a COVID test, which was, it was a little different than the other one that I had, where they took that entire cotton swab and put it all the way up into my brain and twisted it in circles for a little while. That was very, very uncomfortable. So this one was a little easier. They just went around the nostrils. Now, hopefully I'll be able to get the results. My other test, no one ever called me and I kept calling in and I wasn't able to get the results of that. So I'm hoping this one actually pans out. Now, many of you are very familiar with me. I came to these meetings begging for help when I first got sober. I have begged and begged and begged now for damn near 5 years. We talk a lot about defunding law enforcement and the fact that we shouldn't have police as the first responders for mental health issues, homeless issues, or issues involving me. I should have been able to be taken somewhere to actually get drug treatment, to actually get mental health services, to actually put my life back together because I threw in the towel. Why do you people ignore me? Why do you ignore somebody that begs for help? Why can't I be a father? Why can't I be in my daughter's life? I don't understand it. Jeff Rosen, okay, we're not on good terms. I get that, okay, I get that. I'm an activist. You don't want anything to do with me. But what I'm curious about is why you never prosecuted my ex for willfully committing contempt. You will continue to go after me for using an amplified sound device to alert the public what you're doing to me, but the main root cause, you won't do anything about it. She committed contempt for 2 years. Now, I say she's a wonderful mother, okay, but the problem is my daughter is growing up without a father, and we know what happens with that. And somebody said something the other day, and I wasn't too offended by it, but it kind of threw me off. And they're saying, look, you got to do everything you can to keep your daughter off that stripper pole. And it was weird to hear it like that. I was like, whoa, what'd you just say? But women that grow up without a father, we know what happens. I don't understand. I don't understand. Am I talking to the wrong people? Please start paying attention. Please help me put my life back together. Please help me be a father. This is a waste of taxpayer resources, and I'm asking and begging for help. Why can you people not figure that out? There's a lot of Scots out there in this world. There's a lot of them that are sleeping behind your county building. They're down the street on the sides of the courthouses. I just don't understand it. I am confused, and I am begging for help to be a father, okay? Clean and sober father. Thank you.
Thank you. Next speaker.
The next speaker is Christine Clifford. I am unmuting you. Please accept the unmute and you'll have 3 minutes to speak. The timer will start when you begin speaking. Hello, I believe
Hello,
Christine
am I?
is.
I'm sorry, am I
Hello?
back?
Yes. Yes.
Go ahead, Christine.
Christine, are you still there? We were able to
Yes.
hear you. Go ahead.
Can you hear me now?
We
Yeah.
sure can. Go right ahead.
Okay. I'm sorry. I'm not sure what the appropriate meeting or committee is to address this, but I'd like to hear more information about the status of the Memorandum of Understanding between the Office of Corrections and Law Enforcement Monitoring and the Sheriff's Department. My understanding is that this is still not signed and that the lack of an MOU prevents the OCLEM office from doing several key aspects of its work in the areas such as interviews and investigations. DBUG and other community agencies have had a number of ongoing calls from families and the jails regarding COVID. Some of those who have tested positive are in the infirmary. And although jail visits are limited due to COVID, even if they were not, it's my understanding that without this MOU, OCLEM could not interview detainees or staff, review records from custody health, or review videotape regarding allegations, such as deputies not wearing masks. The OIR group was selected in part due to their extensive background with oversight of similar agencies. It's difficult to imagine that the MOU presented to our Sheriff's Department is unique in its scope. So please do whatever is needed to get this signed and allow OCLEM the access it needs to do its work. Thank you.
Thank you. Next speaker, please.
The next speaker is Richard McKeithen. I'm unmuting you. Please accept the unmute and you'll have 3 minutes to speak. The timer will start when you begin speaking.
Hi, good afternoon. I am here to report a child abduction. Approximately 3 weeks ago, my youngest son was taken by his grandmother and uncle and apparently taken to Las Vegas. This occurred in the middle of an adoption case and several other cases that are now before the court. I have been bewildered in trying to contact local agencies. The police told me when I tried to report this a couple of weeks ago that it was a civil matter and they could do nothing. I reported this to the district attorney's office last Friday and have not received any communications with them since, even after repeated attempts to get in touch with someone. I have been in the process this morning of exchanging emails with the deputy director of our local DFCS department, who apparently denies that there is any problem, and then had the department attorney speak to me, basically saying, sorry, you have no case here. I am bewildered, astonished, and quite frankly, do not understand why local law enforcement and other agencies don't seem to be taking a child abduction seriously. One of the abductors is on probation for a DUI in San Mateo County, a fact which no one here ever discovered. And here I am, weeks later, still wondering when someone is going to call me and when someone is going to take my report seriously. I do want to give a shout out to Supervisor Ellensberg's office. Supervisor, I spoke with Basil last Friday, who agreed to arrange a meeting between us, and I hope that that can still take place. I am deeply saddened by what has happened, completely mystified at the response of local authorities and officials to a child abduction. I shouldn't have to wait here and be in fear for my child's safety. I shouldn't be told by people that if I'm not a lawyer, I can't report it. And I have emails from multiple sources now, basically stating just that. Supervisors, other people, the only thing I want is my son returned to the state of California. That's it. I expect more of an explanation than sorry, there's nothing that we can do. And that's my story. Please, if someone can contact me, help me, I would deeply, deeply appreciate it. Both myself and my older son, we want to see our brother and our son return safely back to the state of California as quickly as possible. Thank you.
Thank you. And I do know that Basil Sala is following up with you, and I'll make sure that that's expedited. And ready for the next speaker, please.
The next speaker is DBUG Community. I am unmuting you. Please accept the unmute and you will have 3 minutes to speak. The timer will start when you begin speaking.
Hi, how you doing? This is Jose from DBUG. I actually have some family members here. If each of them could have their 3 minutes, I'd appreciate it.
That's fine. Go ahead. Every individual speaker may have 3
Okay.
minutes.
Okay, let's start off.
Okay, my name is Lisa Urango, and I am Marcos Jimenez's aunt, who is incarcerated right now in the county jail. My nephew actually had got COVID while he was incarcerated after being solitary for 4 years, and for him to be able to get COVID is like it's crazy. I don't even know how to explain it. I'm gonna start crying. I just got stuck right now. I'm sorry.
She's getting real emotional. Sorry about that. I know that if you like, we could probably hold until
Yeah, I'll come back.
until the item comes up.
Yes.
But I do appreciate you. We have another family member here.
I am Marcos Jimenez's mother, and it was the way they mistreated my son and how they handled the virus when they caught it, and so that's why I'm here to support my son with the situation that he's going through. Oh,
Thank you. And this is just general. Melissa, did you want to speak or?
can I speak?
Okay. And I think that's just about it for now. I know we had submitted some documents, and we'll probably speak a little bit more on the issue when the item does come up. And this is specific to coronavirus in Main Jail.
Great, that's item 4. Thank you so much. Do we have any additional speakers for general public comment?
Yes, the next speaker is Raj Jaidev. I am unmuting you. Please accept the unmute and you'll have 3 minutes to speak. The timer will start when you begin speaking.
Good afternoon. This is Raj Jaidev with Silicon Valley Debug, and I want to give a shout out to the families that are gathering at Debug right now and this body for hearing them. Over the past few weeks, we've received alarming calls from those inside Main Jail, Elmwood, their families and their defense attorneys about conditions in the jail and an inadequate response to COVID. For us, due diligence was forwarding on this information to the sheriff and public health, as they seem to be the institutions that have the power to address the issues. We've also had a few meetings with the sheriff's administration. But despite these efforts, we continue to receive desperate calls daily from people inside, fearful of contamination, those who are COVID positive, including people in the infirmary, describing conditions that would counter to the public health order. Deputies not wearing masks or quickly putting them on when a supervisor comes around, not having enough cleaning and hygiene supplies, an inability to socially distance, being denied showers, and instead being forced to share a wash basin or a bucket, and being laughed at or dismissed when requesting medical assistance or things that could prevent contamination. We bring this to the public safety meeting because we find ourselves in repeated circular conversations that we have to move beyond. We bring forward what we hear, the sheriff responds that things are fine, and then we continue to get new calls every day. So what we are requesting is for an outside agency, perhaps one of the supervisors or public health, to review the video recordings from the jail and the body cams of the deputies to get a factual account of what is actually happening. It may very well be that the sheriff administration may not be getting the full picture of what's happening inside the facilities. And look, if we are wrong, the families and those inside and staff is doing everything right, knowing that would ease the concerns of these families that you just heard from. But if there are changes of procedures or process that need to be made, this county can then act on those immediately. And if public health or whoever reviews the footage can issue a public outward-facing report or have an online forum where people could ask questions, that too would be very helpful. We need to get out of this dynamic where we communicate what we hear, we are then told that those things are not happening, and then it's essentially he said, she said, she said. So we're asking point blank for someone from Public Safety Committee to review the footage and find out what the factual truth is so that we can move forward with a common understanding of what we're facing. Thank you.
Thank you. Before we have additional speakers, I want to issue a couple of reminders. First, to the clerk, we were giving 3 minutes because my understanding was that there were 4 speakers. we now need to give everyone those 3 minutes, but I understand that the number of speakers is growing. So I'd like you to cap it with whoever has already signed up. Let's close public comment there. And I also, so that anyone who's teed up certainly will have the opportunity to speak. And I also want to remind the speakers that this is general public comment, which is a time reserved for items that are not on the agenda. A number of speakers have talked about COVID, which in fact is our item number 4. You certainly have the right to speak to any item you like, but I'm going to ask respectfully that if you've already made your points about COVID during the general public comment, that you don't repeat them during the public comment opportunity with each of the specific items. So with that, let's have our next speakers, please.
The next speaker is Nareli Campos. I am unmuting you. Please accept the unmute and you will have 3 minutes to speak. The timer will start when you begin speaking.
Hello?
Yes, we can hear you.
Okay, thank you. My name is Nareli Campos. I'm with Silicon Valley Debug. Debug is currently working with the PAR unit, the pre-arraignment and representation. Before COVID, we were helping them support families with loved ones and finding ways for pretrial release. And since COVID, PAR has not been able to continue their work because they don't have access to going inside the jails and bookings. I think one of the ways PAR can benefit is if they have tablets that are available for their clients to have tablets. That way the attorneys can be able to reach their clients during booking, and so PAR can have a better way of continuing their work. Thank you.
The next speaker is Cecilia Chavez. I am unmuting you. Please accept the unmute and you'll have 3 minutes to speak. The timer will start when you begin speaking.
Hello, my name is Cecilia Chavez, and I'm an organizer with Silicon Valley Debug as well. And just want to echo the family's concerns around COVID, the need for the PAR unit to have tablets. And I also want to speak to the reports that we've submitted to you all in regards to the broader conversation around what public safety looks like for our committee. And just want to echo that we are listening and we would really want to be part of this conversation moving forward. I'll leave my time to others so they can speak on other issues as well. Thank you.
Thank you. Next speaker, please.
The next speaker is Andrew Bigelow. I am unmuting you. Please accept the unmute and you'll have 3 minutes to speak. The timer will start when you begin speaking.
Hi, everyone. My name is Andrew Bigelow. I'm an organizer with Silicon Valley Debug. I wanted to just echo the concerns and kind of the severity of what's happening with the COVID outbreak inside the Santa Clara County jails. Yesterday on the Debug phone, on the Debug staff phone, we got a call from a family member who's said that they had talked to their loved one and who had contracted COVID inside Elmwood MA unit, and that they were actually having to use socks to wet their socks and put on their foreheads to try and help with the fevers. There's drastic stories like this that we hear all the time and that family members are hearing from their loved ones inside. And the situation is really dire. And so I just wanted to echo some of the conversations and some of the stories that we've heard, so that there could be a sense of urgency and action around what's happening inside the county jails in regards to this COVID outbreak. Thank you so much.
Thank you.
Oh, excuse me, Madam Chair. We have one final speaker.
Thank
Okay,
you.
the final speaker is Vinay Bihar. I am unmuting you. Please accept the unmute and you'll have 3 minutes to speak. The timer will start when you begin speaking.
Hello?
Yes, we can
Go
hear you.
ahead.
Hi, my name is Benet Vehar. I'm a community organizer with Silicon Valley Debug. And I had the debug telephone last week, and I heard numerous stories from the women's side. They're dealing with COVID as well, and they need some answers. And unfortunately, families have reached out and tried numerous times to get in touch of some kind of communication with the sheriff or administration to even see what the plan is or what the plan of action is anybody going in there to check on them? Is anybody giving them sanitation, cleaning supplies? It's actually horrific to hear the stories of these families, to hear what they're going through, and to actually, you can't sit there and tell them something that's not happening, and you just feel so helpless to really want to help these families. I urge the Public Safety Committee to please do something, try to help these families. Thank you.
Thank you very much. Reconfirming, Frank, that there are no further comments on public comment?
Yes, that's correct. No further speakers.
Great, thank you. We'll move then to approval of the consent calendar. I want to make a couple of comments about that, get hopefully the support of Supervisor Wasserman, and then we'll go to public comment on consent. I'd like to request that we hold item 9 to the next PSJC meeting. This is the annual report from the PreTrial Services Department, and want to acknowledge that COVID certainly has had a significant impact on their caseloads, and that I would like to explore the issues that they're facing in more depth at the next meeting when we don't have quite such a packed agenda. Additionally, I'd like to keep item 11A on consent, but just make a quick comment to thank the sheriff for the grievance subcategories report. That really is extremely helpful. And I'd like to ask that the next time that same type of report be provided for Elmwood and the women's facility as well. And with that, do you have any other additions or changes, Supervisor Wasserman?
No, Madam Chair. If that was the motion to approve 8, 10, and 11, I will second it.
Very good. And let's go to public comment.
Thank you. I did just want to give a shout out to my mom's very good friend, Irma, who is 99 years old and contracted COVID. And yesterday she was announced fully recovered.
Go Irma. Very nice. Thank you. Do we have public speakers specifically on items on the consent calendar?
We have 2 speakers in queue.
All right. They'll have 2 minutes each then, please.
Great. The next speaker is Robert Aguirre. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking.
Oh, Robert Aguirre. I don't know what was going on, but during a public comment, I had my hand up, and like 2 or 3 times the hand was lowered, and I know I didn't do it. I wasn't even touching my phone at the time. I just noticed that my hand was lowered, but I don't know what's causing that. Anyway, what I'd like to talk about is I know it's not on the consent calendar, but the trailers. If we could somehow get somebody to look into the fact that the trailers were asked to be returned to the state wasn't asking for them, and we have a loss of a great number of temporary housing for people that are living outdoors that would have an opportunity to have a place to stay. And I know that not all of the trailers were in bad condition. I was able to actually see the insides of the trailers, some of them, not all of them. And a great number of them were brand new. And I don't know why the city and the county wanted to give them back. But I think it's very important that we find out when staff is reporting back to the board and says that the state took them back. I'd like to get the clarification if they took them back because the state wanted them back, or they took them back because the county and the city didn't want them. And I think it's a travesty. Thank you.
Thank you. Next speaker, please.
The next speaker is Scott Largent. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking.
Thank you, everyone. Scott Largent. I'm not too sure if there's a glitch in the Zoom system. The last meeting, if you go through the minutes, you'll hear me have a temper tantrum after I was finally able to log on. I'm not saying that you're doing this, Susan. I like the clerk. He's a cool cat. I'm not saying they're pushing a button trying to nuke my comment, but there's a glitch in the system. I'm over at the Mexican Heritage Plaza. Robert Aguirre is kind of right across the way. He had his hand up on there. Maybe, just maybe, we could, make some accommodations for people that are having technical difficulties, because if it happens with anybody on that dais there, you immediately have tech support. You immediately have staff. And I think it's very important to hear from a member of the public right now that's at a COVID-19 testing site, behind the Mexican Heritage Plaza, in the most affected area in Santa Clara County, basically in the state of California. And that is a man we need to hear from. So I'm going to go ahead and stop right there. Maybe we can make accommodations to hear a little more from him on the process. I think we can make that happen. I do appreciate it. Thank you.
Thank you. Next speaker, please.
There are no more speakers, Madam Chair.
All right, thank you very much. Then with that, we will move on to item 4. Which is a verbal report from the PSJ departments on COVID-19 response. And the way I'd like to do this is ask the departments to each give their brief reports. We'll then, I'll turn to Mike to see if he has any clarifying questions. We'll take public comment and then come back to the two of us for any comments. Does that work for you, Supervisor?
Excuse me, Madam Chair, can we do a roll call vote for the consent calendar?
Absolutely.
Great. Vice Chairperson Wasserman?
Aye.
Chairperson Ellenberg?
Yes, thank you for keeping us on task. Martha, should I turn it to you?
Sure, thank you, Supervisor. We're going to start off this item 4 with comments from the Office of the District Attorney.
Thank you very much. Good afternoon, Supervisor Ellenberg, Supervisor Wasserman. Let me give a brief COVID update from the District Attorney's Office. We continue to work closely with County Counsel and other law enforcement agencies in the county to enforce the public health order. We have 6 prosecutors and 4 investigators working full time. We receive 200 to 300 referrals or contacts from the public every day about the shelter-in-place order and what it means, and if someone is violating it or some business is violating it. To date, we've received more than 11,000 referrals or questions about the public health order since it went into effect a few months ago. Secondly, the jail population remains slightly below 2,100, which is the lowest the jail population has been in decades in Santa Clara County. It's the lowest incarceration rate we've had in Santa Clara County in probably our entire history as a county. In terms of jury trials, I really want to thank Judge Ryan and the Superior Court judges. We are prosecuting jury trials again. We're calling in anywhere from 2 to 4 juries per week. It takes a little bit longer to pick the juries, but the court has done really a tremendous job in making it possible to try jury trials in a safe way with plexiglass and a lot of space and everyone wearing masks. And I know I talked to my other DA colleagues around the state, and we are by far trying more cases than any other county is at this point. So we're certainly nowhere near up to 100% in terms of what our capability is, but we're certainly, as I say, trying anywhere from 2 to 4 cases a week now, which is a really significant development. Fourth, last week, we marked the 1-year anniversary of the mass shooting at the Gilroy Garlic Festival with a memorial ceremony at Christmas Hill Park that was attended by both Supervisor Ellenberg and Supervisor Wasserman, as well as Board President Cindy Chavez. It was a very solemn and sad affair. The victims' families were on hand, but we felt that this was really important to do for those families as well as for the whole community of Gilroy to mark this 1-year sad anniversary. And finally, In the DA's office, we've been working the last several months on what our operations are going to look like given COVID, and even when COVID is, we have a vaccine for it, whatever the new normal is. And so we've produced a report that analyzes the different options that employees will have for working remotely. About 25 to 30% of our staff comes into one of our offices each day. The rest are working remotely. We're in the process of figuring out how to continue that remote level of work going forward. We know the county executive has said people should plan for remote work through at least February of 2021. That's our report.
Thank you, DA Rosen. Moving on to the Sheriff's Office.
Good afternoon, supervisors. This is Assistant Sheriff Davis. I'm joined by Under Sheriff Sung, Assistant Sheriff Bender, Assistant Sheriff Doty, and Lieutenant Oberdorfer. Just a brief on COVID in the jails. First of all, we'd like to acknowledge that we understand that compliance in the jails across all work groups, civilian and sworn, is not 100%. And because of that, we are striving to implement protocols to enforce 100% compliance, not just with the social distancing, but also with the mask wearing and proper mask wearing at that. Our current stats to date, we've had over 1,500 employees tested, of which 34 have come back positive, for approximately 2% of those tested. The inmate populations, we've had over 4,800 incarcerated tested. Currently, overall, 119 have come back positive, and currently we have 52, which has been our highest number currently in custody that are positive, which is just about 1% of the overall numbers tested. Understanding that we have work to do, and certainly being sympathetic to the community and the family of those incarcerated, we do know that we need to put greater focus on how to improve our systems, and we do that with public health as well as custody health. This past Tuesday, we had invited Dr. Hahn to come out to Elmwood, so he came out and did a visit. And he too even noted that he sees significant improvement with regards to enforcing public protocols. However, he did not see 100% compliance either. So on an administrative side, we know that we need to increase supervision, increase potential corrective action and otherwise to make sure that we are 100%. He spoke about the dorm environments not being great environments for those who have not tested positive, but those same environments at M8 for those who have tested positive are able to cohort, which is not information that's well known to the public. We've gotten a lot of concerns that we're putting individuals who have tested positive in the same housing areas, but those are done basically at the recommendations of public health. So we really are trying to stay in line. Not everybody understands those protocols, but we are adhering to the directives and working closely with those different expertise. Lastly, I'm happy to report that Custody Health has started testing all of our staff. We just started on Monday, and they have extensive hours and significant commitment to making sure that all of our staff are tested within the next couple of weeks, and then on an ongoing basis about every 5 to 6 weeks. We are also looking to make sure that we're 100% compliant in that area as well, but we've got some weeks ahead of us to get there. So that's all I have to report.
Thank you very much, Assistant Sheriff Davis. We're going to move now to Superior Court. Judge Ryan. You're on mute, Judge.
Sorry about that. So while the Superior Court is not a department of the county, we certainly are a justice partner with all of you, and I'm happy to report in on our activities. So the court is grappling with a crushing budget deficit of $16.7 million caused by the cut in funding in the state budget. This has caused us to use voluntary separation agreements, furloughs, and layoffs to reduce cost. It is a very difficult time for all of us, and particularly for those who have lost their jobs in the midst of this epic pandemic. We are not able to operate our court as we have done in the past, nor do we expect this to change anytime in the near future. Accordingly, we are constantly planning and revising our plans to ensure that we can still provide a robust justice system that provides necessary access and the ability for individuals to have their cases decided. Our courts look different. There is a mandatory order requiring the wearing of face coverings in the courthouses, and we've had some of the same issues with the compliance there, but we do keep working on it. We have beefed up the sanitation of our courtrooms and all public areas as quickly as we can, consistent with supply and budget issues. We are outfitting our courts with plexiglass barriers to assist in reducing transmission of the virus. We are working as fast as we can, again, subject to supply and budget issues, to provide remote equipment for courtrooms that we are opening. Some courts are operating some calendars completely remotely, and others have the capability of offering remote testimony. The effects of the pandemic and the budget deficit have affected all areas of our court. While we have been able to open and operate courts in our family and civil divisions, they are certainly more limited than they have been in the past, and people have to wait longer to have their matters heard. In the criminal division, which I know this committee is most interested in, as I advised before, we have remained open from the beginning, back on March 17th, when the first shelter in place went into effect, for in-custody arraignments, preliminary examinations, violations of probation, some mental health court hearings, and hearings to address bail or sentencing on those who are incarcerated, to help move their cases forward and assist in keeping the population of the jail at a level that was more consistent with public health concerns. We appreciate the collaboration of all of our justice partners in these efforts. We have gradually and with measured step been able to open several case management departments, misdemeanor departments, and have had 6 or more matters proceed to trial and are continuing to get matters out to trial. While this may not sound like a lot, as Mr. Rosen said, we know that there are some courts that have not even begun to do jury trials, even in time not waived cases. The process is much slower. We have to call in more jurors. We have to be prepared for more hardship requests, and we have to be sure we can provide the appropriate social distancing. Through all of these difficulties, we remain committed as a court to providing the community we serve with a justice system centered on fairness and equality. We appreciate the many conversations and activities that are going on in our country regarding issues of race discrimination and disparity, are working to continue to educate ourselves, examine how our system works, and be part of the solution. Thank you.
Thank you very much, Judge. Next, we're moving to the Public Defender's Office and the Alternate Defender's Office.
Good afternoon. Thank you very much. It's good to see everybody. As Mr. Rosen mentioned, we have started doing trials again. So we've done 5.5 trials. The half was one that began pre-shelter in place and pre-COVID, and the others have been post-resumption of trials. So there's an alternate defender case currently in trial, and we've engaged in four others that were misdemeanor matters. I mentioned this on our public safety call yesterday, but one area of concern that continues to be on the front burner for the defense is the difficulty in communicating with our clients in court. It's practically impossible, if not completely impossible, to talk to our clients and be 6 feet apart wearing masks without shouting about the facts of their case. And so we are looking at several options. We're going to pilot some transceivers that interpreters use in court so that we can put headphones on our clients and speak while being socially distanced and wearing our mask. in a way that allows for confidentiality. We also have purchased some face shields. So we'll try to pilot those as well in the next week. But the other issue that's kind of been on our minds is the crowding outside the courtrooms. Right now, they're limiting the number of people who can be in the courtrooms. And of course, the calendars are upwards of 50 to 80 people because of the backlog and the reopening of the court. So what we have then is a number of people waiting in a small area at the Hall of Justice right outside the courtroom who end up waiting for quite a while and pull their masks off and are not socially distanced. And our lawyers are the ones going out into those hallways to talk to the clients and to call them into court. And one of the problems, I really commend Judge Ryan for her initiative in issuing the order to wear face coverings early on. But there really isn't anyone to enforce that issue. And so what would be extremely helpful is if the deputies in the courtrooms would help us keep people 6 feet apart and wearing their masks. And if the judges themselves would always wear masks and participate with us in trying to keep everyone safe as we muddle through. So I encourage and applaud the reopening of courtrooms, but unless we can do it safely, it's really hazardous to members of the public, our clients, and our lawyers. So I'll stop with that. Thank you.
Thank you, Molly. Next is the Independent Defense Counsel Office. Celia.
Thank you. Good afternoon, everyone. We focus our operations during this COVID period primarily on ensuring that we maintain the quality of customer service we have provided to the community. And we continue to maintain that. All of our operations are essentially remote. We only operate in the main office once a week as needed. And we've been able to be very effective in that regard. In addition to providing that service that we provide to the judges, the courts, our justice partners, we also provide a significant service to the public in answering questions about access to the court. And in that regard, we have, I think, provided a pretty effective service. We continue to be collaborative with the court by helping them and helping private attorneys make connections to ensure they have access to links so that remote hearings can occur without delay. And we also continue to work collaboratively with everyone, including the Sheriff's Office, to remove barriers for our attorneys to ensure that they have access to their clients, particularly those in custody, with whom we're focusing significantly on ensuring that whenever hearings can take place for clients in custody, they do go forward. And so we try to eliminate as much of the barriers and the delay that are sort of ingrained in the system and certainly have been exacerbated by the COVID conditions and situations. So that has been a significant focus of ours, and we believe we've been pretty successful in that regard. Thank you. That is my update.
Thank you, Sylvia. Next is the Probation Department. Chief.
Hi, good afternoon. It's great to see everyone. Supervisor Ellenberg, Supervisor Wasserman. I'm going to start with the institutions because I think that's what everybody's most interested in. And I'm going to turn it over to Deputy Chief Burchard to do that if he's on. And let me see. Okay, I'm going to have somebody try to get Deputy Chief Burchard on, and then I'll go through the services side, and then he'll come on with the institution part. So on the services side, on both juvenile and adult, we're running very similar to what the other offices said. I won't go through it all. Staggered hours, rotating in and out, coming in, getting work, staying for the least amount of time possible. What we have done differently in the past probably 2 weeks is we decided, this is a long haul. It's clearly a long haul. And we made the decision to run the data and see, how many of our clients have been seen, running by risk level, seeing how they've been seen, how responsive they've been, whether or not that's tapering off over time, and also running the number of bench warrants that have been issued during COVID. And so we're in the process of reviewing that. We'll make decisions based on what we find out as far as you know, when and if we can get people out a little bit more. We're definitely doing some remote, some like distance contacts with clients. Okay, still no deputy
Chief,
chief.
it looks like Nick
There
is
he
on
is.
now.
Awesome. Okay, I'm going to turn it over to Mr. Burchard.
Hello, everybody. Sorry, a little technical difficulty there. You can hear me, correct?
Yeah.
Good. Of course, the line that everybody says, and everyone says, "Oh my gosh," they're asking if they can hear them. Sure. So here at Juvenile Hall, and I see that Andrew's on the line as well. This really started back with us in March, early March, really, and a convening that took place with public health, custody health, public health, the Juvenile Hall medical director, nurse manager, and we started meeting really every day. And that was Monday through Sunday, so it included weekends, just to start to get our hands and wrap our hands around this whole process, what it entailed. And we've continued to meet. Now we meet twice a week, not to say that we understand what's going on, but as we've kind of put protocols and practices in place, we think that we now pretty much can follow these practices and protocols when and if we have an exposure. Like I said, we put protocols in place from staff screening to youth screening when they came into custody. And probably one of the things that we all know that differs than, say, from the county jail is just the number of kids that we get in custody in comparison to the county jail. So we were able to start a screening process for every kid who came into custody immediately. They would get screened for a COVID-19 test. And through the public health department, we were able to get that turnaround back within 24 hours, maybe a little bit more on average. So by being able to separate that youth that came into custody and get that test results back, if we did have a positive case, we were able to isolate that youth in the medical clinic and have appropriate care by the medical staff without really impacting any other youth. One of the other things that we did right away was really separate, and because we had the availability of our facility, and limit the number of kids in each unit. And so we had a place where, if you think about, we only had 10 kids in each unit by just opening up multiple units so that we could allow for social distancing and for staff and for youth. It allowed for us to create that space so that kids, if they did come in, wouldn't infect any other kid and staff as well. So that's been very, very beneficial for us to be able to have that space to create social distancing. To date, since March, we've had 3 youth who have been positive. We were able to capture them right when they first came in the door, give them a test, and found out within the next 24, 38, 36 hours. And by doing so, able to mitigate any spread of COVID-19 throughout our facility. So I think that we've been very successful, as successful as you can be during a pandemic, of at least mitigating the spread, making sure that all staff, all youth are wearing masks. We constantly call over our intercom system, remind staff, remind youth to put their masks on. We had public health department come in and do a tour and give us their thoughts and ideas of how we could continue to improve our systems. They gave us a very positive report, which was good, but you're never sure, right? And so you always continue to grow and learn and take that information and continue to upgrade and update our policies and procedures. And working with the public health department, who certainly guides many directions and decisions that we make, has been very helpful and very beneficial. So today we've had 3 youth positive, 2 staff over that same time period. So far, so good, I guess.
All right, thank you. Moving on next to PreTrial Services, Matt.
Yes, I'll take just a quick moment to update. Thanks to all of our partners. Over the year, the client load has doubled. Last year at this time, we had 1,500 people. Now we have about 3,000. And only with the help of everybody from Debug through the Sheriff's Department, prosecution, defense, behavioral health, probation, and everybody in between have we been able to keep up so far. In some ways, we've improved. In other areas, we would like to resume services. The 2 areas where we feel we've fallen behind is in court attendance and some updates for the courts on cases. and also drug testing. There are about 450 people in the community that were being drug tested before and aren't now. So it's a question of whether or not we resume that now and have them circulating in the community, but getting drug tested, or how we might accomplish that. So we'll be having those discussions. But the office otherwise is up and functioning. It's staffed every day. The jail, thanks to the court, be accessible at any time. I can call a judge at any hour of the night or day, and they are ready and helpful. So the jail's operating 24/7. We're interviewing. We are providing the reports for the family court decisions, and electronic monitoring. They have close to 700 people on ankle bracelets, many of whom would otherwise be in jail. And we're also supervising somewhere around 2,600 people right now on pretrial supervision. So all is well. The staff have maintained their health. We've had to plastic wrap our department and just have extra cleaning done every week, pretty much, from the FAF's department. And sheriff's departments helped us at the jail. I will say this, where there's been confusion with protocols, when I stand back and look at it, there's been confusion or any sort of friction. When I stand back, it's really employees doing their best, trying to expedite processes, trying to get that review to the judge quickly, get the person released from the jail safely and promptly. And sometimes we end up tripping over each other. But for the most part, it's been a really good collaborative effort. My greatest concern right now to complete this is kind of the few individuals left in jail that are releasable. And those individuals tend to be individuals who suffer from co-occurring disorders, mental illness and or substance abuse addiction. They often need to be on some sort of electronic monitoring device and may be sent to a program, and they may be suffering from physical health issues as well. And so that really requires a lot of collaboration from all the parties, and it's something that we can definitely improve on. You know, what does a safe and healthy release look like where everybody's involved, and if anything, there's overlap so we don't leave any gaps. So you'll hear more about that in the future. Thank you.
Thank you, Matt. Moving on to Reentry Services, Javier.
Good afternoon, Supervisor Allenberg and Supervisor Wasserman. Just quick updates. In the month of July, the San Jose Reentry Resource Center saw about 842 individuals, about 38 clients per day, and that is low compared to our pre-COVID numbers of 100 a day. For South County Reentry Resource Center in Gilroy, we served about 27 clients in the month of July, about averaging 2 a day. The top requested services in person at the Reentry Center here in San Jose is social services, public benefits, followed by housing and the medical mobile bus. And then in the center in South County in Gilroy, the top in-person request is faith-based services, followed by public services, public benefits. In the month of July, we submitted 13 referrals to Catholic Charities for Employment, 43 referrals to Goodwill. So our CBOs are running remote services and doing a really great work with our clients. The medical mobile unit in the month of July saw almost close to 1,000 clients, serving reentry clients and the general public clients, providing medical service, psychiatric services, pharmacy, and then connections with the community health worker. Another update is that in our partnership with the County Office of Ed, County Office of Ed hires a teacher, a full-time teacher, that will be providing educational services at the Reentry Resource Center, getting our clients prepared for the high school diploma and also fulfill their GED requirements. In addition, we are going to be doing some town hall meetings with some of our stakeholders. So we'll have one coming up later this month. We're going to start with the introduction of Reentry Services with Pastor Tony Williams for our faith-based collaborative and Pablo Maxiola from Goodwill Industries. And then finally, we are in really great collaboration and partnership with the Office of the Sheriff, Probation, Office of Women's Policy, Custody Health, and Probation to work with the women in custody. So we have identified the women that are going to be released within the following month, and we're doing some transition discharge planning, providing documents to the women in jail, getting that information back, and then linking them to our service navigation providers. So we continue doing our best, working with our partners to assist our clients re-entering into our communities. Thank you.
Thank you, Javier. Our last speaker is Andrew James from Custody Hall.
Hi, good afternoon, everybody. Can you hear me okay, Martha? Okay. Good afternoon, everybody. I'm going to give a quick report on our COVID status and build upon what A.S. Davis and D.C. Berkshire reported. We currently have 52 positive cases within our adult system. We rounded with Public Health Department and also in collaboration with our custody partners and developed new cohorting guidelines, which are in alignment with the CDC guidelines and recommendations for correctional settings. And these guidelines would help us contain the virus a lot better than we had in the past. And we remain committed to patient safety. We've tested nearly 1,400 patients in the past week, beginning Friday, to ensure that individuals are not positive. And if they are, they're isolated immediately and put into one of the cohort units. In addition, we're committed to staff safety. We've tested nearly 400 staff members between the two adult facilities, Elmwood and Main Jail. We have successfully implemented the staff surveillance testing program, which is available 7 days a week between the hours of 11 a.m. and 1 p.m. and then 4 p.m. and 8 p.m. Staff members can just go to the nurse's station and get tested over there. And this week, we've extended the hours 7 days a week, and they can come at any time, including night shift. The Juvenile Hall baseline testing will take place in the next week or so. I am working the details with DC Berkshire. And we plan to test everybody there to make sure that we have baseline testing on all the staff members. And then the staff surveillance hours also have been implemented at the Juvenile Hall facilities as well. We continue to enforce the use of masks, social distancing, and hand washing as well. Thank you.
Thank you, Andrew. Supervisor Ellenberg, that was our last speaker. With that, we can take questions.
Thank you so much. Supervisor Wasserman?
There's my mute. No, ma'am, no questions. I appreciate all the reports and being updated.
Great. I have a couple of comments that I want to make, but let's go to public comment first. And how many speakers do we have?
We currently have 4 speakers in queue.
Okay, let me just say loudly for anyone that is listening, if you would like to make a comment on this item, now is the time to raise your hand and get in the queue. And thinking that we probably will get at least one more and have 5, let's do 2 minutes per speaker, please, Frank.
Great, will do. Thank you.
Thank you.
The next speaker is Debug Community. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking. Hello?
Hello?
Yeah, we can hear you.
Hi, my name is Jose Valle with Silicon Valley Debug. I'm joined by 3 family members who will speak, and I ask that they have their due time to speak as well. At Debug, we act as advocates for families whose loved ones who are often incarcerated and facing charges. Recently, we received a number of concerns from family members who have their loved ones in 5B in the main jail, as well as MC in the Elmwood, and some of them of which were subject to getting exposed with COVID positive. They were then not treated properly, told to share a dirty mop bucket to bathe in, and mocked and intimidated them when requesting to file a grievance. In addition, COVID has severely impacted visits, out of cell and rehabilitation programs, and access to essential commissary. We have met with the Sheriff, Office of Ombudsman, and the new Oakland office, and have struggled to get some answers in justice. Visits are back, but limited. Justice commissary is back, but limited. no matter what, I think there's nothing that could really take back from the experience of these men who, for the most part, were pretrial innocent until proven guilty. None of them were sentenced to catch the coronavirus or getting treated like animals after being tested positive. Simply put, the jail is not designed to hold human beings during a pandemic. I'm now going to pass it on to 3 family members. There's also another family member that should be on the call that's separate and on her own Zoom. I'm going to go ahead and pass it to Melissa and then the 2 other family members.
Okay, they're going to reset.
No, you go ahead. Just go ahead and start speaking.
Okay. Hello, my name is Melissa Warden. My husband has been incarcerated for 3 years with a 3 strikes law holding him back at the main jail. I have created a social bio packet known as a social history that the DA is regarding in his Bend the Arc reforms. From my understanding, my husband will be participating in a peaceful protest of their own. And so this strike will be very meaningful to me as well. I am in full support along with so many others whose voice will not be heard today. A hunger strike to shed light on commissary that is at the bare minimum when it should be an essential, especially during these times as it is to us. Courts that are being pushed back out, which adds to some of their anxiety, sanitation that isn't in full compliance, face mask, which is also not in 100% compliant, racist gang enhancements and 3 strikes law, and the urgency for Sheriff's Office to agree for Oakland to begin investigation inside the jail. Thank you.
I'm going to then pass it on to Lydia.
My name is Lydia Uringo. My son is Marcos Jimenez. He's been incarcerated for 4 years.
Go ahead. Go ahead.
He's been incarcerated for 4 years now, and I have found out he was positive. He's the second person was tested in there, and when he brought it to my attention that he was given a mop bucket, that to me did not sit right. I came to Jose, and he's the one that helped me with everything, and then with the other inmates were in there that don't have anybody, I spoke for them too. And now that they moved him back because he is no longer sick, they have not tested him. They put him back with the other people and did not test him at all. So I was wondering what is the right proper channel to go to have my son retested to make sure that he is not a carrier for the virus, because he does have a son. I have a grandson that's 4 years old. They would love to see his dad and be with his dad again. He didn't ask for the virus. He didn't ask for it at all. He was doing his time. Now the little boy's worried about his dad. So am I. He's my only son I have.
Excuse me, my name is Lisa Urengo, and I'm Marcos Jimenez's aunt. I'm Lydia's sister. Basically what it is the inmates are not getting tested in there, and some of them are probably getting released and some of them are not. But I mean, it would be nice to, test the inmates, you know what I mean? I mean, Juvenile Hall is doing it. I mean, testing them as they come in or whatever. I mean, that should be mandatory for them to be tested as they come in, or everybody that comes in their facilities, all the facilities, for them to even be getting the COVID. I mean, they're isolated already, and people that are coming, the workers that are coming in and out, not wearing, doing the proper precautions to prevent the COVID from coming in the facilities. You know what I mean? I mean, just basically, they need to be tested too, and to make sure that they're healthy. They're clean. They don't have the COVID. And that's what my nephew is concerned, Marcos Jimenez, and he does his baby, wants to see him and everything, and he's just worried about him having it. Why didn't they test him when they moved him from where he was at when he was sick with COVID? Thank you.
Thank you.
I'm sorry.
Thank you. I think we also submitted a document with their original complaints that was sent out to the administration and various other parties. Appreciate your time.
Okay, the next speaker is Scott Largent. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking.
All right. Good afternoon, everyone. Scott Largent. Just kind of trying to get a quiet spot over here. I have been bringing this up a lot lately in regards to the bathroom issue. During the COVID pandemic, we've just opened up the bathrooms at a lot of the parks. The water is still shut off. The bathroom at the county building is the only other real accessible one. The sheriff's department does have a bathroom. Sometimes it gets shut down, due to the protesting issues. There might be a scare one day where they put up the riot fence. We need restrooms. We need the ability to shower, to bathe, I think this is very important to stay clean right now during COVID. When I was over at a protest over in Santa Cruz County, they had the actual real portable showering stations. They had the laundry machines. They had all this behind their county building. And then they had an entire area set up to actually give people water, feed them, hygiene, all of the above, everything that people need. But in Santa Clara County, when I show up to the county building in the morning, there's 20 or 30 people sleeping in the other section over near the old city hall, out in front, next to the jail, on the side of the parking garage. Of course, you have me living in your county lot in a van. Let's get more organized. Let's figure out how we can help everybody right here. They're there. The people are right in front of you. And, take this any way you want to take it, but you people should be ashamed that you walk past that in that hallway at the county building and you don't do anything about it. Okay, you guys have walked past Tammy there for 4 years? That woman's gonna be dead soon. I just wish you would do more.
The next speaker is Cynthia Jimenez. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, my name is Cynthia Jimenez. My son is Raul. He's also a detainee in the San Jose main jail. Instead of echoing what everybody else said, my son has went through all that and more. I do have recordings of the doctor on one of our meetings saying that the inmates will be tested 3 times before they are released to general pop, which I have spoken and recorded all of the inmates who have called me and said, no, they have not been retested. And they are actually going back to regular pods with people who haven't been tested. They are being treated as if they are a deadly disease and nobody wants to be around them, which it is true. It is a deadly disease, and nurses have told them to not to say they still have symptoms. I'm glad to hear the report from the Sheriff Davis saying that there have been improvements, but till this day, I'm still getting phone calls about staff not wearing masks and so forth. There was a person by the name of Isaiah who was detained. He had to clean a cell that was filled with feces. He gave a report. Grievances are not being given. They're in there, but they're still human. They still need to be treated with some kind of decency. What is going to happen to them when they get released? It's not their fault they got this. So what happens to them? Who's going to isolate them? I have COPD. My son can't come back home to me right now. So what's going to happen afterwards also? Thank you.
The next speaker is Robert Aguirre. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking.
So Robert Aguirre here. I hope I'm not beating a dead horse when I bring this up again. We need to have much more representation from the unhoused community in all decisions that involve them. And I think also we need to have better reporting from any COVID testing that's done that reports back what the situation is among the unhoused community. I think it's critical that we do that. And if we ignore that, we're going to possibly be facing a real problem with the rise in numbers as people start mixing with each other in the unhoused community. So therefore, I would strongly suggest that we start collecting this information. And even if you don't want to make it public, make it available to those people that are involved, the advocates and the unhoused themselves. Because as they go out and do the testing publicly, they're only notified if they test positive. But oftentimes these people lose their phones or lose an ability to be contacted, and then you have to go around and try to find those people. But if we knew what areas they were from, we would be able to help out with that and help keep a contact with people that I see all the time, and people that know people, to be able to get this information out and try to get a better control over the situation. So thank you for that. Bye.
The next speaker is Victor Vasquez. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you so much for this opportunity. Originally, I'm here to speak on other items, but I feel like I'm compelled after listening to these stories that to just say a couple words. So we know the United States of America has the highest incarceration in the world. We know California is right behind them. And in this population is always Black and brown people and poor people who are overrepresented. And we know a lot of these situations happen because of conditions and bias conditions, racial conditions and policies that have increased the overrepresentation of Black, brown, and poor people in the jail system. And so when we look at these life and death decisions, at the end of the day, these are also values of racial justice and economic justice that we got to look through them, along with COVID. Because where I'm from and where I'm at, COVID is impacting our Black and brown people in their neighborhoods, in their workplaces. And even when we are incarcerated, that's the same impact. And so hearing these stories, hearing their pain, I hope that we can address these situations. They say it more eloquently than I can. And it's disturbing to know that these are like the conditions that incarcerated human beings are going through. And it's so disturbing to hear that there's reports of people not using their masks, paid public people. And I can only imagine being confined in such a small space that's already probably not in the best conditions and not having the correct medical equipment needed. I want to remind you, these are human beings. Black and brown lives, incarcerated or not, they matter. And this is a situation where we could take action and shift the way that we look at society and uphold our human rights. They have human rights that have been overly stated. Prisoners should receive health access services available in any country without discrimination or of their legal status. That's a human right that's been passed. So I hope that we can listen to the families and take actions. These are reasonable actions. Investigate, take action, provide the medical needs, and take corrective action. Thank you.
The next speaker is Peggy Bryan. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking.
Thank you, Peggy Bryan, a pastoral associate, St. Andrew's Episcopal Church, Saratoga. We, pre-COVID and now through mail-in, have worship services in Elmwood. We did, and now we do the mail-in. So I get lots of calls during the week, and the prevailing sentiment in the calls is fear. So I wanted to make a suggestion. What I have seen, or what I have taken, is that most of this fear is from those that they don't know what's going on. They're told to be quiet. They're told to stop asking questions. They're told don't say anything. There's this code of silence that they say the guards is expecting of them that just fuels their fears. So I would encourage the administration to be much more forthright with communication, help the detainees understand what's going on. Honest transparency will go a long way to keep everyone calm. They understand the danger. They see it on the television. So the more that they could know really what's going on, honestly, I really think it would be to everyone's best interest. Thank you.
The next speaker is Raj Jaidev. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking.
Thank you. I stated the main concerns during public comment in the beginning of the meeting, but I did want to restate them expand on them a little bit in hopes that there'd be some discussion by the committee members about the proposals. The central proposal that we want to put on the table is for the supervisors or county executives or other respective agencies to review the body cameras and the footage of video from the jails in Elmwood to see exactly what is happening when people aren't particularly looking, or there isn't an escorted tour of the facilities, but actually to see the day-to-day operations, to see the level of compliance by staff. And again, if they are in full compliance, then that's going to put a lot of these families at ease that had called in through their tiers. But if they're out of compliance, we could then chart out a pathway where this county develops what the response should be, how it could reorganize staff and their respective safety protocols. And the second most effective strategy to prevent COVID from spreading in the jails is to continue us decarcerating and depopulating our facilities. DA Rosen said that we had the lowest incarceration rate since the inception of the county. And I think that proves that we need to continue down that trajectory because the sky hasn't fallen. Crime rates have not increased. In fact, they've decreased. And if we want to continue to protect our people, then the safest way is not only to expand safety protocols within the jail, but to continue to decarcerate. What that means for DA Rosen particularly is to not oppose requests for releases or bail motions that public defenders and defense attorneys propose. And lastly, if people do get sick, I'm requesting in the jails that they then get taken to these motels that the county is invested in, that they're housing unhoused people in, so that we could protect them, depopulate the jails, and take advantage of the resources that are available to us. Thank you.
We have no more speakers, Madam Chair.
Thank you so much. I just have a couple of quick comments and requests. The COVID tracker on the public website is incomplete, so I'd like to ask staff or whoever's on the call today acting on Dr. Smith's behalf to upload the trend data, because simply posting the number of cases is insufficient. Most of the comments, painful as they were to listen, about transmission of or preventing transmission of COVID in the jails is really critical for so many reasons, and really requires constant vigilance over the long term of this pandemic to avoid the outbreaks that we've seen across the US and San Quentin as a clear cautionary tale for our region. Early action by the sheriff and the public health department and others to reduce our jail population and put strong protocols in place to screen inmates coming into the jail has been very effective, and I want to thank all who are involved for that quick and critical response. But I continue to be concerned about the risk of introduction of the virus into the jail by staff, attorneys, or others that come in and out of the jail. This circumstance imposes, I believe, significant responsibility on those that leave the locked facility to go home at night, to take every precaution to prevent introduction of COVID into the jail. And this is essential, not just because we care about the well-being of our residents in custody and not just to protect staff working in jails, but also because we know that jails can amplify transmission and impact the overall course of the pandemic in our community at large. So given the scope of the demand and the coordination needed across agencies here, I would like to see one senior official responsible for all aspects of our jail COVID prevention activities be designed to coordinate the work. One role be designed to coordinate the work between the sheriff, custody health, public health officers, and any other relevant entities. One person with a full-time commitment to this role should be keeping tabs on getting us to universal routine testing of all employees, access to and compliance with face coverings, contact tracing efforts, and protocols for safe resumptions of family visits. Clearly, this will continue to be a team effort, but coordination across the many components is essential and requires full-time attention. And as I think that our most senior folks here today are probably Martha and Miguel, I'm going to look to both of you to provide my recommendation or direction to Dr. Smith to the effect when we discuss the COVID response at next Tuesday's Board of Supervisors meeting, ideally along with the name of the senior executive who will be tasked with that role. Essentially, what I'm talking about really is the Deputy Chief of Corrections, given the fact that our current interim Chief of Corrections, who is also the county executive and the director of the emergency operations systems, simply doesn't have the bandwidth to give this matter the attention that is required. So just want to confirm with Martha and Miguel that that message will get passed along and that a recommendation will be included in the next board meeting's public health update.
Yes, Supervisor, hear loud and clear. That will be provided.
Thank you so much. Much appreciated. Supervisor Wasserman, would you like to make a motion to accept this report?
Thank you. I've got a comment or two, if I may.
Oh, of course. My apologies.
Thank you. No worries at all. I appreciate the suggestion that you just made to staff to forward that suggestion to Dr. Smith for their consideration and getting back. I would like to add a little bit on to it. I heard you say full-time responsibility, and I think what you were implying is that an existing staff member take on this additional responsibility as compared to hiring a person whose full-time responsibility was to watch the gates, so to speak.
I'm not talking about a new hire. I am talking about amongst our excellent staff that we already have, letting somebody fully focus on this work. I know that our staff is stretched very thin, and having 8 or 10 or 12 responsibilities, I think necessarily means that some priority issues don't get the attention they deserve.
You know, I'm sure that's the case system-wide, absolutely. But I think what'll happen with your suggestion is that Dr. Smith will evaluate various people's current responsibilities, see who has that extra bandwidth, and assign that accordingly. I do want to say that our public health department is constantly checking out the jails, and people going into the jails, people going into assisted living facilities, people going into long-term care facilities. Those are all confined spaces where there's either more vulnerable people or there's more proximity between people. And unfortunately, with this very nasty virus that's invisible, there's so many people that are asymptomatic. There's tests that are not positive. So doing the best we can to prevent people who have COVID from getting into the jails is, of course, everyone's goal and everyone's priority. And I know nobody who has it knowingly goes there. And I'm certain all the fine people represented on our Jeopardy screen here and all the staff that works for them and with them follows all of our public health officers' guidelines as far as masks, gloves, social distancing, washing, etc. So I appreciate, and again, it was very moving testimony. I agree with you as far as what we heard today. I appreciate all that's happening. I also appreciate all that public safety does on a 24/7 basis to do all they can regarding this invisible virus that we have. I went yesterday to pick up some food at a restaurant. I opened up the door, wondered who had touched the door. I got my food, wondered who had prepared the food, wondered who touched the food, wondered who put it in the bag, wondered who handed it to me. When I exited, ran into the same thing. I think we're very focused here because of the nature of this committee, Public Safety and Justice, and our particular focus at this morning on the jails. But even in the public defender's office, even in the district attorney's office, even in probation's office, even in Javier's and everybody else's office, anybody can get it at any time. And us assigning people, Supervisor, for certain responsibilities like the jail, I would hope that everybody takes on that responsibility that works there. And if they see somebody without a mask, they refuse them admittance. And that we have a cleaning program going on that I'm not aware of. where things are rubbed down, where people come in and out. So I just wanted to expand a little bit more on your suggestion and improve however we can.
You've gone from expanding to transforming it. So I want to come back and be clear that, of course, we have people working on this. And to your comment that Dr. Smith should find someone with extra bandwidth is exactly the issue. We need somebody who is just doing this work and therefore jettisoning other things. A significant difference between you're going to a restaurant, of course, is that you have that choice. And the people that are confined in our custody do not have the option to decide what risk they're willing to take. Do they want the takeout enough to hold on to the door of the restaurant? We have a higher duty to people that we are requiring to be confined. And I think there's also a gap between what our ideal procedures are and ideally what everyone should be doing and what is actually happening. To my knowledge, public health, and I may be slightly off in the numbers and happy to be corrected, but I'm aware of just 2 times that public health has been into the jail to do this kind of work, both at our suggestions and urging. So I believe that there is more that we can do and more that we must do. And I'll look forward to hearing a response to that during the public health report at our next board meeting, since it's not an issue we're going to resolve right now.
Thank you. And what I was referring to is the people coming in. I was addressing bringing in of the COVID virus.
Right. No, I understand.
I was not responding to the practices behind the walls, behind the bars. I was talking about what was coming in. And I think there's 2 parts to this issue. There's the preventing the virus from coming there, and then there is the reducing the spreading of the virus once it is in there. Yep. When I know of our policemen, our firemen, et cetera, that do all that they do, and then they get it in the firehouse, or the people that do all they do, there's just some places that it's going to happen. And we do the very best we possibly can, but it somehow gets through somewhere. And I think there's prevention on the outside and there's treatment on the inside. So I'm looking for improvements in both areas. Thank you.
Terrific. Do you have other comments, or do you feel ready to make a motion?
I will second the motion that you made.
All right then. To the clerk, to Frank, I believe do we need a vote?
Yes.
Yes.
On that?
Vice Chairperson Wasserman?
Yes.
And Chairperson Ellenberg?
Yes. We are now going to move to items 5 and 6, which we are not only going to hear together, we're going to flip the order and start with number 6. Let me just pull up my notes with my apologies. Hold on, sorry. Okay. Thank you. And thank you, Yvonne, for magically making that happen. I want to thank everyone on this committee and the public who has joined us in advance for preparing to participate today in a conversation on what more we as a county and as members of the community can be doing to promote greater justice and equity locally. When we met last in June, I left all of the folks who are on our virtual dais with some homework and asked them to prepare several things to reflect on some of the things that your department is doing well and should do more of, to reevaluate any things that are not working and that perhaps we should stop doing, and to bring back a couple of new services, policies, or protocols that will lead us to more just outcomes, particularly for people of color in our community. And I would never ask anyone to do something that I am not doing myself. So I have been busy with my own homework as well. My office sent through many hundreds of emails and posted on every social media platform an invitation for community members from across the county to engage in a series of 3 facilitated conversations so that I could hear from them their experiences with any aspect of our county's public safety and justice system, and suggestions regarding how we as a county might reassess the way in which we ensure public safety and justice for all. All 4 of my colleagues supported this effort by promoting the community conversations, and I want to thank them all for their help in spreading the word about this opportunity to be heard. In order to make it clear that my role was to listen and not to lead on or shape the conversations, my team worked with 3 outstanding facilitators who managed the calls. These 3 very competent women worked to uplift every voice and to create a safe and supportive space that allowed for rich discussion. In total, 480 individuals engaged in meaningful dialogue around policies and recommendations to promote greater justice and equity, both within and external to our public safety systems. Participants hailed from each supervisorial district and represented a broad spectrum of races, ethnicities, ages, and gender identities. In addition to the community conversations, I held 18 separate meetings with community-based organizations that are in some way engaged in the work of promoting public safety or justice in their communities. Included in the draft report, presented for the first time here today, are the testimonials and policy recommendations of community members and stakeholder groups. Their prescribed public safety reforms can be summarized in the following 6 themes. The first is crisis response. Law enforcement frequently responds to calls that may not be within their purview, such as behavioral and mental health crises. Community members may also not know what agencies exist to properly help individuals in need. And many residents recommended exploring an alternative dispatch system that distinguishes between individuals in crisis and crimes in progress. Second theme is reimagining law enforcement. And here, community members shared their vision for a revised role of law enforcement, both armed and unarmed officers, in a safe and thriving community, including a reduced or, in some cases, non-existent law enforcement presence, particularly on school campuses and in public gathering spaces such as parks. The third theme, upholding justice, reflected community members' expression of the need for independent oversight that would assure accountability and transparency when it comes to the discipline and investigation of law enforcement misconduct. Residents also recommended expanded training for law enforcement in the areas of racial bias, de-escalation, and nonviolent approaches for nonviolent dispatch calls, among others. Fourth theme is prevention across the continuum. And here, community members voiced the need for more supportive programs that can divert residents, particularly youth, from becoming involved in the county's justice system. Included also was the prioritization of PreTrial Services, which focus on maintaining individuals in community rather than incarceration. Residents also recommended support for incarcerated individuals and their families, such as eliminating jail fees, fines, and the cash bail system. Healing the community was another theme that we were able to identify based on the feedback that we got. And in this area, community members called for the reinvestment of funds to focus on the needs of vulnerable residents, such as before and after school programs, health services, including physical, emotional, and mental health, infrastructure improvements, and programs designed to lead to thriving neighborhoods. Either our 5th or 6th theme, I think this is the last theme, strengthening community, came from community members' discussion of the need to foster greater relationships between neighbors, community organizers, and local government officials with the goal of amplifying their voices in county decision-making. Details for each of those 6 themes can be found in the draft report that you all have today. So what is next for this Community Conversations initiative? That is where the rest of this committee comes in. The recommendations that you all provide today will be added to this community conversations report, which will then be finalized and forwarded to the Board of Supervisors on August 25th, along with recommendations for next steps and guidance regarding implementation. I'll also note, to set up everything today, that my team wasn't the only group that was working to engage the community on this critical topic during the past month. Our administration also sought community feedback specifically in response to a referral by my colleague, Supervisor Simidian. And I know that Melanie will provide a summary of that effort, and then we will turn it over to the departments for report and discussion. So handing it to you, Melanie.
If I could just go ahead and step in, Supervisor.
Oh, absolutely, Martha. Go right ahead.
Sure. I just had a very brief verbal report today. So this is the first part of our response to that board referral you just mentioned. This part of the referral, as you said, asked administration to conduct stakeholder listening sessions. The focus of these two sessions were discussions on community input regarding that referral and to gain insight.
Just to be clear, you're talking about Supervisor Simidian's referral. I just want to make that clear, correct?
Yes,
or this
yeah,
one?
For the clarification, Supervisor Simidian's.
Thank you.
Well, thank you. We received about 300 registrants for each event and nearly 500 follow-up emails with comments, which are attached to the report in the packet. The details in your packet will then be presented on August 25th, adjacent to Supervisor Ellenberg's report. And we did coordinate with Supervisor Ellenberg's office to have the two sessions follow her three community conversations with it, but our specific focus was on policing policy reforms. The Office of Corrections and Law Enforcement Monitoring, called OCLEM, agreed to facilitate these two sessions for us, and Mike Giannacco from OCLEM is on the call today in case there are questions. Very briefly, I just want to thank the community and for the overwhelming response and dynamic public conversation. I also want to thank the county departments, many of whom are on the call today, as well as labor unions, for attending to listen. The overall themes, very briefly, it was very clear that participants felt passionate about their community and the safety of their neighborhoods. Attendees reflected on the makeup of the diverse population we have in this county. There were many different backgrounds and viewpoints, but a common theme was a shared desire to listen to the other community members. Moving on, there was also a willingness to listen to opposing viewpoints and be part of a shared solution. In a survey during the meetings, results showed that the top three reasons people attended were to listen, learn, and advocate. That was listen, learn, and advocate were the three biggest reasons for showing up. So as I mentioned at the beginning, this report and all the detailed community input will be added to the broader submitting referral response on August 25th. And I will pause here for questions.
Thank you. Supervisor Wasserman?
No, ma'am.
I have no questions either on that piece of the report, please. Happy to move on to the departments when you're ready. We'll do all of those, and then we'll take public comment, and then we'll come back for discussion, conversation, or comments.
Supervisor, are you looking for the departments to go in order or speak out as desired?
Whatever you have teed up with them.
I think we'll just, they can comment as desired then, please.
Okay. Oh, let me be more specific then in my question. Are we not getting the recommendations from departments today? That's coming on the 25th?
With regard to the community listening session, Supervisor?
No, I didn't realize sorry, I'm not being clear. I had no expectation that any departments were formally commenting on the community conversations that were run by administration. What I'd like to do, having presented my report, hearing about your community conversations, now I would like to hear the department's presentations of what they would like to recommend with regard to enhanced and improved public safety, get all of that information out at once, hear from the public, and then have the conversation. But certainly if there are questions about that report, that's certainly fine. We can do that now amongst committee members. Neither myself nor Supervisor Wasserman has any questions on that.
Okay, my apologies for the misunderstanding. Yes, we do have a presentation from many of the departments represented here under item 5. All right. So with that, I'm going to cast my screen and begin. Can everybody see that?
Yes.
Okay, thank you. So as you mentioned, this item 5 it's a study session requested by Supervisor Ellenberg at the June 4th Public Safety and Justice meeting. There are 8 departments presenting today on their intersection with the topics we're discussing, mostly to what promotes positive change and continued growth in our county, programs and services that provide an alternative to engagement with the criminal justice system, information on prevention and addressing root causes of poverty and structurally racist policies, updates on diversion and reentry, utilizing behavioral health and substance use treatment service providers and advocates for victims of intimate partner violence to support law enforcement. So I'll be introducing each of the speakers in turn, and it sounds like you'd like to take questions at the end, correct, Supervisor? I'm sorry, you're on mute.
Thank you. That would be my preference, but Supervisor Wasserman, if you prefer to ask questions in between each of the reports, I'm certainly open to that.
Thank you. No, I'm fine.
Okay, let's do it all and then questions at the end.
Thank you. So with that, I'm going to invite Behavioral Health Services to start.
Great. Good afternoon, Supervisors Ellenberg and Wasserman. Sherry Terrell with Behavioral Health Services Department. I wanted to go ahead and introduce our 3 presenters who will be sharing information with you today. First will be Mikkel Lee, Division Director, who will be providing a presentation on our mobile crisis response team. Second, we have Sandra Hernandez, Division Director, who will be presenting on our psychiatric emergency response team. And finally, John Costa, our law enforcement liaison, who will be sharing information on our law enforcement liaison program, the intervention interactive video simulation training, and our crisis intervention team training.
Excuse me,
So
Chair.
go ahead and, yes.
Hi.
Hi.
Excuse me 1 minute. I had a question for the chair.
Sure.
Supervisor Ellenberg? No. Okay, I'll address this direct to Martha then through the chair. Martha, we have all these reports in our binder.
I don't know what's happening. Sorry, I can't get my.
Nope,
there we go. Sorry, I'm clicking away.
Thank you, Chair. I just wanted to ask a question through you of Martha, if I may, before the presentation began.
Please, of course.
Thank you. What I was saying is that you and I have this presentation in our binder, so I would just ask that the presenters give us something else, be it a summarization, be it other information that we don't have, etc., as compared to going through each of the pages of the report.
I certainly share your proclivity toward brevity, but I do want to make sure that each department has the opportunity to share with us their specific recommendations. So absolutely. If there is more to the report and there's background and context, I agree that we don't have to do that or go through every slide. If we could get to the recommendations from each department, that would be ideal. Thank
exactly
you.
What I was asking. Thank you very much.
All right.
So if I could interject with the departments, if you have specific slides that you'd like me to click to, just let me know. With that, Sherry, go ahead.
Great. I'm going to go ahead and turn it over to Mikkel Lee, and she can highlight some of the areas around mobile crisis and response. Thanks.
Hi, this is Mikkel Lee.
Can I please have the next page on mobile crisis response? Great, thank you. So I would like to share mobile crisis services data for calendar year 2018 in comparison to 2019. And I want to explain a little bit in terms of what the call services, field visit, and 5150 means. So in the 2018 is when we first launched the program. So it's a beginning development stage, and there's a lot of learning. The calls / referrals at that time, we didn't start with having a phone line. So we started with referrals from law enforcement. It was first initially made for law enforcement only. First made available. So looking at the data we have, in 2018, we have about 413 referrals or calls in total. And the number of services is the same. The reason why we indicated as the same number, because at that time, again, it's a learning. We're first learning to track data and teasing out what to track. So we put the number of services as the same as number of calls, but not all calls are the same as number of services, meaning true crises cases. Field visits are the actual visits that we respond out in the field, and 5150 are the number of individuals we place in psychiatric lock facility, emergency psych for treatment. So if you look at the data in 2018 in comparison to 2019, there's generally over 100% of increase in all areas. Again, except for the number of services provided, because technically in 2018, the number of services should be smaller, but we count the number of referrals as the number of services as well. But if you notice, that's a trend, that's an increase in 2019 in comparison to 2018. Can I have the next slide, Sherry? Thanks. I want to show a little bit of a upward trend in data or number of services that we provided during COVID-19 pandemic time.
Sherry, apologize for the interruption. I just want to make sure that we're all on the same page. I did ask for 3 things, and you're sharing with me presumably the things that went well or things that were challenges. But what we're asking for in the verbal reports right now is just kind of the end of the story. What are the recommendations? More of these services, less of these services, totally different services?
Yeah, I would like to recommend more of these services because the demand is increasing. As you look at the upward trend, there's a huge demand, and we are in operation 24/7. So I would really recommend there's an continue an increase in the number of services for mobile crises. Is that what you're looking for? Supervisor?
All right, if that's as specific as you've got, certainly. Yeah, I'll ask some questions at the end of all of the reports.
Thank you.
Is there anything else from behavioral health on this item or any other slide you want to highlight?
Actually, this is my section, so I'm happy to proceed. My name is Sandra Hernandez, Division Director, and I am tasked with the Psychiatric Emergency Response Team and Peer Linkage Project. It's an MHSA project, so it's grant funded for 2 years. And as you can see, we have some, I think, really good goals that we're trying to assess, and that's, how we can help divert people to other services rather than to our psychiatric emergency rooms, to other resources. And so this is a co-response crisis model that we're pairing licensed clinicians with law enforcement, sheriff, to in real time. They're in a patrol car, and they're going to be responding to calls that are really behavioral health, needed. And so the hope is, again, it's about diverting services. So what makes it unique is we're adding a mental health peer support linkage component to this. So we'll have folks who have lived experience who will be able to help and assist these folks that we encounter to help ensure that they get linked to services, that they don't fall through the cracks, that we do get them re-engaged basically in services, and so that they're not really out in the street, and that we're getting the help they need, they're getting the help they need, so we can continue to do the work we want. I think what's probably new is we do have the partnerships committed, as you can see, with the County Sheriff's Department, Palo Alto Police Department, Morgan Hill, and San Jose PD. And so I'm really thrilled that these are really departments are very committed. The moment I had discussions with them, it was immediate that they were on board. So no struggle. If you can go on to the next slide. And so what the staffing here is, we've got 8, like I say, clinicians, licensed clinicians, which will comprise 4 teams. They will work for 10 shifts, so 4 days a week, 10 hours a day, 7 days a week. The hours are there. They'll span 11 a.m. to 11 p.m. You know, we looked at data and we think this is a good amount of time. Of course, we've really highly encouraged, you know, bilingual candidates because we want to meet our threshold languages. We live in a very diverse community here in our county, and so we recognize that need. So that's, you know, still a focus that we want to continue. So if you could go on to the next slide, please. So here's what's going on. Actually, we had interviews on July 20th and 21st. And we have 2 candidates that are moving forward in the process. In fact, while I was listening in, I was quickly responding to emails because we're trying to get them onboarded as soon as we can. What's interesting about this particular position is that not only will the candidates go through our own county personnel background clearances, they will need to go have a live scan and a law enforcement background clearance. It's really more so similar to a civilian type position, because we want to make sure that we have the right people paired with the right, you know, right places, and everybody's going to be safe and secure in that kind of work. And so the candidates all knew that going in. There were no surprises. I've kept everything very clear and clean so people would know. And so 2 people have said yes, and that we're going through that process now. So I have 6 more positions. I had a 3rd, but unfortunately she had to back down and decline. What's going on in July is September, as I've noted here, we're, you know, collaborating, working together. There'll be a lot of training. We're going to phase in this process. It's not something where we're just going to put people together and say, now drive away. We need to have lots of training that we'll be doing jointly. I've already engaged with our county counsel on developing MOUs with the different departments so that we can get that going as well, so that we don't have any glitches that come up saying, why are you doing this? So we're trying to do that. And then the biggest piece we have is we've already secured our evaluation component with the Resource Development Associates, which we're happy to be working with. I've worked with them prior when I worked on the IVST program that John will be talking about. And so we've got a lot of work we've done and a lot of it documented, and we're really moving in the right direction. And this is a program I'm very passionate about. I'm very passionate about all work with behavioral health and law enforcement. And so, you know, I'm hoping this will be a continually funded program, but we'll wait and see what the evaluation provides us. And that's all I have.
That's super exciting. Thank you.
It is.
I've been hearing about PERT for a long time, and I'm just thrilled that it's actually
I am
ramping up.
too. I
can hear it in your voice.
Thank you. I'll pass it on.
Is there more content from behavioral health?
Yeah, I think John Costa is going to be responding.
I was just going to speak briefly about some of this area.
Correct.
Good afternoon, everyone. And my name's John Costa. I'm one of 3 law enforcement liaisons with Santa Clara County Behavioral Health. We report directly to Mikkel Lee, who you already heard from, as well as Sandra Hernandez and Margaret Obelar, our other division directors. Sandra just mentioned that training is going to be a big part of the preparation and transition for the PERT team. And that's exactly what we facilitate in the law enforcement liaison program. And that is to reinforce training, not just for officers, but our service providers across the board, but just as importantly, to increase the teamwork, communication between our law enforcement agencies countywide and behavioral health services, again, across the board. Not just county services, but also our many full service providers. And the reason we do that is there's so much crossover. That's one of the reasons they created this position, to address that crossover. And it makes sense to promote the teamwork, the communication, and the main reason why we all serve the same client. We're all working towards the same positive outcome. So it makes perfect sense to collaborate, train together, work together. Our mobile crisis team and our PERT team that is on the horizon are two stellar examples of that. So again, we're the bridge between law enforcement and behavioral health. A big part, in addition to that referral and communication work that we do, is also our long-term training that we've done through interactive video simulation training. And that's the program that was developed about 11 years ago. We've trained over 7,000 peace officers in Santa Clara County alone since that time. And the training is really based on increasing an officer's ability to recognize and react through best practice techniques in terms of communication and de-escalation, to try to steer something towards more successful conclusions where we don't have to use force, if that's possible, to reduce incarcerations, hospitalizations, and try to help steer those cases into what we hope is long-term sustainable treatment and recovery. That's all part of that teamwork that plays into it. And we have two different formats for the training. The training expanded 3 years ago, in part through State Senator Jim Bell's sponsored SB 29, which increased the amount of training that our officers from the basic academy and beyond are required to successfully complete as part of their critical ongoing perishable skill requirements. So I'm really proud to be a part of both the liaison, the teamwork. It's been extremely well received by law enforcement. And by the way, for the liaison team members, that's our background. We all have essentially law enforcement backgrounds along with teaching and public education. So again, the training, a really important component of that. But strongly recommend this continues and keep that teamwork going. Again, for the reason, nothing more than we're treating the same client, working toward the positive outcomes. So thank you for your time.
Great. So thank you, John and Sandra and Mikkel. Again, just to summarize for behavioral health, it will be the commitment to our continued partnership regarding mobile crisis and our work with our law enforcement liaisons and partners. And secondly, to ensure that we will be implementing our psychiatric emergency response teams. Thank you.
All right, with that, we're going to move to pretrial services. Matt?
Thank you very much. I'd just like to share that I had a great experience a few nights ago with the mobile crisis unit. It was past midnight, and I contacted them. They immediately dispatched me to Mr. Costa, who just presented to us. And it was a client that I shared with Behavioral Health Department, specifically the FACT team. Client who was suffering from co-occurring disorders. He was in duress and was seen in duress, but then kind of went lost. That client was flagged, and I think it was the very next day she was located, and she's in a safe place receiving care right now. So that one went very well. It's just a good example of how that can go. And I really appreciated the court's approach on it, that they didn't just jump to incarcerating the person. They actually set up a court hearing. We had a doctor present. We had other means by which we could support that person. So that was one success story, among many other challenges, I'll be honest with you. So I'm going to go through mine very quickly because I was able to give this presentation a few weeks ago. To respect your questions, Supervisor Ellenberg, more or less indifferent. So pretrial's role, if we could go back one slide, please. Pretrial's role is really very focused on providing support, neutral support, informing judicial decision-making, and ensuring that clients appear in court free of new offenses. That's our goal. We want it to be safe, accessibility, fairness, and effectiveness for all parties, clients, victims.
Excuse me, through the chair, I'm having a hard time hearing that.
Oh, okay. Let me disconnect. Good
right there. That got better.
I got down from 5 screens to 1. I think that'll be better.
Thank you.
Thank you.
We seek safety, accessibility, fairness, and effectiveness for all the parties we serve, and we really do our very best to focus and remain neutral. We can go to the next slide very quickly. This is designed to lend itself to questions. This is the process we use at the jail, 24/7, 365. This is how we screen clients that come through the jail. Keep on moving. Go ahead and go to the next slide, please. So pre-COVID, we focused on 3 measures: safety, compliance, and court appearance. And typically, 95% of people would go to court without a new offense, without a technical compliance violation, such as contacting an alleged victim without being convicted of such a thing. And about 2 out of 3 people would attend court. It actually improved on court attendance. It's closer to 3 out of 4 people. That means they attend all court appearances.
You're getting a little garbled again.
Okay, let me see if I can get a little closer. You might have to see my face a lot closer than probably a lot of people, but.
Thank you.
Okay, and I won't need glasses anymore. So we're improving. I think, honestly, I think that the remote telephonic and soon to be video conferencing visits have helped us to increase the frequency of contact with our clients and lessen the burden on them having to come in person as often to the office. Although some would benefit from coming in person, and we are missing out on that. So the next slide shows how we're measuring things right now, because typically our performance is measured on case closure. We're not closing as many cases right now as court is being delayed necessarily. And so we've been looking at the number of people rearrested, and I'm grateful to say that so far, as Raj said, there has not been a significant spike in crime. The county has, and has for many years, had a challenge with recidivism. That challenge persists. There is a relatively small group of people that are rearrested over and over again and spend very little time in jail and need to have certain needs met. And I'm confident that some of the measures we heard about today through behavioral health will be very helpful. So far, so good. Not a negligible spike in crime. Not all things are the same. People are generally home, and law enforcement is different right now. I just want to qualify that. I would say, just to give you an idea, the percentage of people that I'm concerned about that are arrested and rearrested, somewhere around 5% of the total population of people that came into jail over the last year.
Matt, you're going in and out again. I don't know if you're facing the microphone or what.
Okay.
There.
Okay, maybe that's better.
Yes.
I hope it is. I apologize. Okay, we can go through the next couple of slides actually very quickly. I think my slides lend themselves more to questions at the end anyway. The next slides represent a study we did recently. And if we could go to the survey slide, that would be helpful. So we asked 2 main questions. We texted 2,400 clients over the course of a week. We were pleased that about 20% responded. That gave us about 545 responses in a week. I was surprised. And those are the people that had phones. So let's be honest. I know the need is greater, but those who had access to phones answered the following 2 questions. What type of help are you in need of, and how much? do you need the following kinds of help? We asked them in what we consider to be priority order. And this is something that models a commonly used criteria of questions that substance dependence and mental health counselors will use. We talked about housing, food, medical help, mental help, alcohol and drug help, transportation, reliable transportation, employment, financial stability, and other services. And then we further qualified it by saying, have you tried to get such help? And if so, how successful was it? You can see the answers that follow. If we could go to the next slide. I'll just say quickly, something that Chief Carnett pointed out, that I thought I had the low-hanging fruit. Actually, I missed it. I was looking at the opposite, the negative. I looked at how at least half of the people needed something in each and every area. And there was probably a dip when it came to mental and alcohol and drug help because of the nature of those illnesses. But Chief Carnett pointed out that a lot of people said they didn't need help. And we may be spending resources on people that don't necessarily need help and not giving help to those who need it. So this will be helpful. We can skip past the next slide and go to the following one because it's just a different view. So again, Chief Carnett saw the green. I missed out on the green thinking my low-hanging fruit was among the 80% on the blue side, which said, I didn't know how, so I didn't try, or I tried, but my situation is the same. The number one answer, unfortunately, of people who tried but were unsuccessful was we didn't get a call back. And so I think that might be a byproduct of the COVID-related struggles. And I do think that we can do a better job. I realized talking with Javier Aguirre from Reentry Services, PreTrial only shares 15%, at least a month ago, 15% of its clients with Reentry Services. And I know if you go to Reentry Services, there's a really nice lady or gentleman at the front counter that will speak to you once you get your name in their computer system. So that means only 15% of our clients had walked through that door. That's a definite area for improvement for PreTrial Services to take on. Okay, I think at this point, I'll probably skip one, maybe two slides and conclude. But I'd just like to emphasize, yeah, I think, so PreTrial, normally the performance looks pretty good as compared to other parts of the criminal justice system. I suspect it's because the durations of supervision are typically shorter, and because we think that clients that are released would tend to be on their best behavior or going in front of a judge and jury. That may or may not be true. In this situation, the pretrial supervision durations are going to be longer, and pretrial has limited capacity. I'm very proud of my staff. I can't believe how they've just stepped up to the plate and found a way to do things. They've been very creative. They've been very patient with me, and they've just taken on whatever's come to them. At this point, we really need to rely on our partners that have expertise in the areas of anchoring, platforming, and bridging. Basically.
Thank you, Matthew. I think the issue is not your distance from the microphone, because I don't think you could be any closer to it, but you're still coming in and out.
Okay, I'm going to go ahead and conclude to respect other people's time, so hopefully you can hear them. I'm just going to say that we need to rely on the rest of our partners more than ever. Thank you.
Thank you. Thank you so much.
Moving on to probation.
Hi, good afternoon. Thank you. I too will be brief. Martha, I'm just going to kind of talk, if you don't mind just flipping through the slides a little bit, that would be great. So the question that I was answering, that I thought we were supposed to answer, so I'll tell you the question that I did answer is how we are addressing systemic racism in our department and how we're operating during these really tumultuous times. So the first thing we're doing is we boldly acknowledge the problem of the stark disparities and systemic racism that permeate the justice system. I think you've heard that from probation on the juvenile and the adult side. Every year that I've been here for the past 10 years, we have been very, very dedicated to this issue. We are super excited about the people that have been dedicated to it and the people that are now finding it something that they want to start dipping their toe into. So along those lines, we're working with the county on the GARE project. Deputy Chief Mike Sims is our point person on that. He's volunteering to do that and really excited about it. We acknowledge the cradle to prison pipeline and work closely with our partners and national experts to disrupt the system. And so that's specifically like the Hayward Burns Institute, Tia Martinez, Nickel, places like that. And how are we going to disrupt the system? We believe that policy should be thoroughly vetted to identify and remove disparities, and by people that actually are affected by those policies. So for example, our Youth Advisory Council reviews policies that have to do with institutions and specific to youth. Recruitment and hiring is where we put most of our investment. We truly believe that who we hire and how we train and support them is the best strategy to combat racism and to help people heal and rehabilitate. We take incredible pride in the quality and efficacy of our staff. Many of our staff have lived experience and most are demographically aligned with our clients. This year we introduced reflective practice to the executive team, the managers, and the supervisors. So that's a space and time to work with the reflective practice coach. Big shout out to behavioral health for helping us set that up and supporting us in that endeavor. It's been really, really great to just have that safe space with your peers to wrestle with issues that are hard and really hard to wrestle with publicly, as you all well know. We have had 2 all-staff meetings. It was like one meeting in 2 parts, specifically focused on race and what was happening with our staff. Those were facilitated by our local EAP and two physicians from the VMC Power Group. Our staff really liked those, and we intend to do another round. So we're talking with them. And then finally, robust data collection and analysis being used to drive more equitable decisions. Again, I really just believe that if you follow the data, you look at the right data at the right times, and then use it to make changes in real time, that's the only way we're going to get to a more fair and just system. And with that, I'm happy to answer any questions. That's all I've got.
Thank you.
Moving on to the Sheriff's Office, please.
Hey, good afternoon, everybody. Supervisors Ellenberg and Wasserman. Rick Sunley, I'm the sheriff from the Sheriff's Office, filling in on behalf of Sheriff Laura Smith. I will go ahead and make a quick opening remark, and I will hand the batons over to our assistant sheriffs here. So the Santa Clara County Sheriff's Office is dedicated to the preservation of public safety by providing innovative and progressive service in partnership with the community. Our mission and our core values have been the guiding principle for our philosophy as an agency, including the development and implementation of our training, policies, and culture. We want to assure the public that the Santa Clara County Sheriff's Office is listening, and we support positive change. And with that, I'll hand the baton over to Assistant Sheriff Bender.
Good afternoon, supervisors. Assistant Sheriff Doty and I will briefly discuss what we are doing well and what we can improve upon, things that aren't fleshed out in the document that we submitted. So what we're doing well, community service levels. The Sheriff's Office is very proud of the high level of service that we provide. Last year, our patrol divisions received over 152,000 calls for service. Our deputies wrote almost 12,000 original and supplemental police reports. They issued just under 22,000 citations, and they made about 3,000 arrests. Our patrol deputies received very few complaints, which shows that they are treating members of the public with dignity and respect, as we expect them to, which is in accordance with the Sheriff's Office core values. Community engagement. We are actively involved with a number of community engagement events throughout the year, such as Coffee with a Cop, National Night Out, Day on the Bay in Alviso, and numerous other community events such as Walk a Mile in Her Shoes, Shop with a Cop, Walk for NAMI, in our annual Heroes Run, where we actually raise money for the BMC Children's Foundation. Assistant Sheriff Doty.
Yes, thank you. And for our body-worn cameras and fleet cameras, one of the things that we've done to maintain and enhance transparency of, and accountability of our deputies' interactions within our jail facilities in the community are to not only implement body-worn cameras throughout our entire jail facility, but also we recently incorporated our fleet camera system for all of our patrol cars that's completely integrated with our body-worn cameras. So that's something that we're very proud of and continue to maintain a high focus for our deputies' accountability. Additionally, we have continued to maintain a very progressive training philosophy. As you are aware, we run a regional police academy where we provide state mandated training to multiple law enforcement agencies throughout the state on a regular basis. So we're very engaged with making sure that the curriculum and content of law enforcement training, not only at our academy level, but also at our in-service internal level, is meeting current and future standards and expectations of the community. So we're constantly evaluating those. Some of the recent training programs that we've implemented that we're very proud of are mindfulness training for the health and welfare of our staff, and implicit bias, de-escalation, crisis intervention. A lot of these are critical in making sure that we maintain the appropriate balance and focus of community engagement and our mandated responsibilities. Our crisis intervention course, this is something that we've recently adjusted the curriculum to provide a little more focus on suicide prevention, other cultural issues within the community that we want to make sure that our staff are well aware of as they perform their duties. And lastly, in this particular section, our staff accountability and standards. We continue to place a very high emphasis on staff accountability and making sure that our internal affairs division continually provides updated training to all of our staff on the process, the expectations of our departmental policies, county merit system rules, and laws and regulations that we hold everybody accountable for. And those are some highlights of things that we continue to enhance and do well within the department. And as far as, you can go to the next slide, Martha covered that. This next portion of our presentation will be areas of growth and expansion, things that we feel that we can do better within the department. Our Emergency Vehicle Operations Center, this was a big investment of the county that we're very grateful for, that not only will ensure that we provide the necessary driving skill training to our deputies throughout the department, but also to law enforcement agencies throughout our entire county. Driving is one of the primary ongoing responsibilities that police officers have, and making sure that they can do so in a safe manner within our community is important. But in addition to that mandated driving training for law enforcement, we are going to be working to develop a teen driver diversion program and working with various insurance companies and DMV to create a program for our teens within the community to not only enhance their driver awareness skills, but also potentially be an alternative diversion to traffic school or other forms of diversions. Our leadership development program, this is a concept that we are working to re-implement, and the intent behind this is to provide employees throughout the organization with skills and philosophies of leadership that are necessary to build succession planning within the organization and highlight and promote ongoing community changes and expectations internally within our department on how we can develop future leaders throughout the agency.
With regard to online incident reporting, the Sheriff's Office really takes pride in our service model of providing in-person deputy response to calls for service. However, we do also see the value in taking advantage of technology to allow people within the community to report things online without necessarily having to wait for a deputy response, particularly in cases such as non-emergency calls, such as lost passports, minor thefts, or cases where there's no suspect information, or cases where the primary need for a report is really for insurance purposes. So we're looking to actually in the process of upgrading our records management system, our RMS system. We're also looking at putting a link and ability to report on our website as well. With regard to expanded data-driven decisions, we're also in the process of upgrading software to be able to do collect stop data, any contact that our deputies have with the public, where we collect data about race, gender, that sort of thing, in conformity with AB 953, which is the Racial and Identity Profiling Act of 2015. We look forward to collecting this data and sharing it with the public and with the Board of Supervisors in an open and transparent manner. Customer satisfaction survey cards. This is something we've done in the past, and we're looking to get back to it in order to make it really easy for the public that our deputies are interacting with to provide direct feedback to Sheriff's Administration regarding their satisfaction or lack thereof regarding the service that they received. And this would be a program where we actually hand out cards that would normally have an event or a case number. It would also have a postage paid brief survey that they could either check in and drop in the mail, or we're looking to upgrade putting a URL in there so that they could also go online and provide us that feedback. And finally, the PER teams, psychiatric emergency response teams, behavioral health already discussed those, but we just want to just make it so clear that this is something that the sheriff has been very excited about for many years and has been on board with and pushing for. So we're excited to be part of the team with behavioral health and to really develop a progressive service model for those with mental illness in the community in order to help get them connected with services, to stay on top of services, and to keep them out of jail and out of EPS when possible, by just making sure that they're getting that maintenance and care to help them stay on track. And that's all that we have for the Sheriff's Office.
Thank you, Assistant Sheriff.
Thank you very much.
Yeah, we express our gratitude to all of our partners, PSJ partners in the county, and we remain committed to providing the highest level of service, obviously, to our public and to our county entity. We'll be available for any questions you may have.
Thank you.
Go ahead, Office of Women's Policy, Pratima.
Thank you very much. Good afternoon, Supervisors Wasserman and Supervisor Ellenberg. We wanted to, can we move to the next slide, please? We wanted to also respond to the specific question of how we're addressing systemic racism. I want to point out the 4 programs that you see on the slide. The Gender Responsive Opportunities for Women program is what Director Javier Aguirre was talking about when he reported on Reentry Services work. In fact, this morning we worked on revamping the program after having conducted a detailed focus group in the jail with women who had unfortunately failed to complete the program, so that we go back with an iteration that responds to their needs. The National Institute of Corrections Work Group is part of Probation, Reentry, and Office of Women's Policy, where we're looking at programming that is gender responsive. I have reported previously to this committee on the jail monitoring program, and I want to focus on a new program that we're going to be partnering with probation on the Young Adult Deferred Entry of Judgment program. I don't like to use the word good with pandemic. However, one of the developments because of the pandemic was the Transitional Age Youth Deferred Entry of Judgment program had a 30-day incarceration attached to the diversion program that would follow after. Because of the pandemic, the 30-day incarceration in Juvenile Hall was taken off the table, and hence I use the word good with pandemic, because we are now looking at a way to sustainably assist probation in this particular program in a way that we take the incarceration off the table completely. May I please have the next slide? I do also want to focus on a very important race equity program, Getting to Zero Incarceration of Girls in Santa Clara County, through the Juvenile Justice Gender Responsive Task Force, Office of Women's Policy, along with Juvenile Probation. Deputy Chief Burchard is here on the call as well. We have identified that if we align our systems in Santa Clara County for maximum diversion, we can actually get to zero incarceration of girls. As we speak today, there are 5 girls in Juvenile Hall, and on Monday, during our monthly JJGRTF meeting, we will be focusing on what system alignments need to happen so that we can systemically align services and get to diversion completely. Vera Institute of Justice has been providing us technical assistance. We're one of 5 counties in the nation working to get to zero incarceration. And in terms of my ask for this group would be, our technical assistance grant it's not a dollar amount, but it's going to run out. And after that, we will ask system partners that are here today to continue to align with us to get to zero incarceration. Finally, I want to highlight that with the youth diversion grant that we received from the Board of State and Communities Correction, we have a $1 million grant that we are partnering with Young Women's Freedom Center on programming for girls in the juvenile justice impacted realm. It's not only girls in Juvenile Hall or Ranch, it's also gender expansive youth that are justice impacted, as well as those who are at risk. I'm happy to close out with reporting that the first cohort of students who graduated with the life skills training program graduated last month, and there were 8 girls who graduated, and they received stipend for participating in the programming, as well as training on using youth participatory action research. All of these are skills that we hope the youth can continue to use in order to continue to thrive in their life. With that, I conclude my report. I'm happy to answer questions.
Thank you, Pratima.
Javier, Office of Reentry Services, please.
I'm having some technical problems. There we go. Good afternoon again. Javier Aguirre with Office of Reentry Services. Next slide, Martha. So, next slide. So one of the questions about how do we address systemic racism and look at structural racism in our community, one area that we know that a lot of our clients come to the center as adults is coming from failed educational systems. Many lack high school diplomas. We noted in our last count about 26% of our clients don't have a high school diploma. And so rather than just abandoning them when they're adults, is trying to provide those opportunities as they re-enter back into our communities as adults. So 23, 30 years forward after starting in the educational system, we're investing in high school education with the County Office of Education. We're also partnering with Coursera, a no-cost MOU to provide free online courses to reentry clients. We have a great partnership with San Jose City College. Many of you have attended our graduation ceremony, about 30 plus students every year that will receive a peer mentor certificate. And some of our clients who have been in prison for 20 plus years, when they return and they take this class, they now have a certificate or have gone to college. And so it is a great pathway for them to re-engage in their communities. Another aspect of investments in our systems that can address poverty is, of course, access to jobs. So we have contract with community-based organizations to provide job readiness services. Next slide, Martha. Employment services with Goodwill and Catholic Charities in terms of on-the-job training and traditional paychecks to get practical skills. Next slide, Martha. So when we look at how do we address causes of poverty and what's working and what can we do, so Pratima mentioned GROW. We also have CAPS in terms of coordinated jail discharging. But most importantly, we are very fortunate that we're working with the county's Racial Equity Steering Committee to create a racial equity action team. We had one of our first briefings with about 32 members of our staff from Reentry Center, key stakeholders, and some of our CBOs, from mid-managers to peer mentors, to address racial disparities in the criminal justice systems, and most importantly, how do we integrate equity in decisions, policies, and practices. Next slide, Martha. I think John Acosta mentioned from behavioral health, his liaison work that he has with behavioral health and law enforcement agencies. We just had a meeting with him and his partners to talk about the Sobering Center. So an investment that we can hope to continue that addresses diversion is the Sobering Center that provides an alternative to jail. All of our law enforcement agencies have access to that 24/7 operation. And not only are folks that are cited or brought in because of their intoxicated, but also if they show any mental health or drug usage. Then we have what's called the holistic program, the Parole Day Reporting Center. So parolees that are coming out of state prison, been in prison for 10 plus years, need a holistic approach. So we have this program for them to address all of their needs. Next slide, Martha. And then finally, two of our exciting partnerships, working with the community to address systemic racism, but also ensure that the children of our clients don't get back into or follow the footsteps, and we end this generational curse of individuals, of their children going into the system. So we have a partnership with East San Jose Peace Partnership to look at preventing intimate partner violence, or DV, with our community leaders. We have a DV program for our parolees, and so we also want to make sure that we also look at the victims in the communities. And then lastly, the South County Youth Task Force is such a great organization that brings in all these entities from Morgan Hill, San Martin, and Gilroy in South County to provide programs for our youth and families to, again, try to end this generational curse of our clients' children entering the criminal justice system. And with that, I'm prepared for some questions at the end. Thank you.
Thank you.
District Attorney Rosen, please.
Thank you very much, Martha. Do you have the first slide up? It's just a little weird to, yes, I see it. Okay. Thank you very much. So, we're at a crossroads, as Supervisor Ellenberg has discussed, and this is a path that we've been on for many years in the District Attorney's Office in terms of trying to reform and improve the criminal justice system. And we don't think this is a time for complacency or lecturing others, but we think it's really a time for change. Next slide. Every year since 2016, we've put out a race and prosecution study to give incontrovertible data concerning the disparities in our criminal justice system between the demographics of our population and the demographics of the defendants that we prosecute, and as well as the victims of those crimes. Without the data, the problems can remain invisible, and it's easy to substitute myths for facts. Next slide. What we have found are persistent, well, anyway, maybe you're missing a slide, but what we found are persistent racial and class disparities. One of the uncomfortable truths that we have uncovered is that within the criminal justice system, there's a very high correlation between not completing high school and ending up in the criminal justice system, or completing high school or college and not ending up in the criminal justice system. By contrast, we also find there's a high correlation between growing up in a neighborhood that suffered historically from redlining and high rates of crime today. In other words, we're not starting from a race blind or a race neutral slate. We're living today with influences of deeply racist policies that were set generations ago. And one of the things we can see, and we publish every year these statistics, it shows us that the demographics of defendants in our county is different than what the demographics of our population are. Latinos are prosecuted about twice the rate of their percentage in our population. Asian and Pacific Islanders are prosecuted at a quarter of the rate, and African Americans are prosecuted anywhere from 4 to 5 times their rate in our population. You'll see on the next slide the victims that are served by the DA's office through Victim Services. Again, what we see are, while Latinos are about 26% of our county, they're more than 50% of the victims in the criminal cases that we prosecute. Whites are approximately 20 to 25% of the victims that we serve who are victims of crime. Asians are somewhere around 9 to 10%, and African Americans are less than 10% of the victims that we serve. Let's go to the next slide. Over the last 10 years of my administration, we've worked very hard to reduce the overall number of criminal cases that we file. And as you can see, in 2011, we were filing about 40,000 cases a year. And last year in 2019, that was down to 30,000 cases a year. That's been driven by a few policies that we have adopted. One is our narcotics public safety policy, where we only prosecute someone for drug possession or drug addiction if they commit that crime 3 or more times in a 12-month period. That has resulted in approximately 5,000 to 6,000 fewer filings each year in the DA's office. And instead of filing criminal charges, we refer those individuals directly to public health for drug treatment. In addition, driving on a suspended license for being poor, for failure to pay fines and fees, is something that we had been filing 4,000 to 5,000 times a year. We will now be filing those directly in traffic court. So our numbers will continue to remain low, around 25% fewer criminal cases being filed than when I took office 10 years ago. Next slide. About decriminalization. It's my philosophy that we should try to limit the impact of the criminal justice system to serious crimes and allow other social agencies to address other social problems, including public health. Next slide. That takes us to the narcotics, public safety, and mental health diversion, caretaker diversion. While we file around 30,000 cases a year, we divert from the criminal justice system thousands and thousands of cases each year, whether that's through the narcotics public safety protocol, whether that's through driving on a suspended license, whether that's through mental health diversion, primary caretaker diversion, misdemeanor diversion, young adult diversion. There are a number of programs that we run, and we are diverting probably upwards of around 10,000 people a year out of the criminal justice system. Slide 9. I think that when the only tool that you have is a hammer, you tend to see every problem as a nail. And it's my belief that we should limit the use of our jails and prisons for criminals who scare us, not for people that we're simply angry at. and that's a difference in philosophy. Next slide. This was mentioned in some of the public comments, the home detention project, parkour. This isn't something that we've worked on with the public defender over the last couple of years. On the one hand, the project is pretty simple. We want to allow in appropriate cases for individuals to serve their sentences in their home instead of in jail. The program allows people to go to work, school, treatment, public service, and this way we hold people accountable and get them treatment without incarcerating them. And the program reveals a deeper truth that for too long our criminal justice system has been overly focused on guilt and punishment and not focused enough on public safety and rehabilitation. This project allows individuals to turn to service and rehabilitation first while their criminal case gets resolved, instead of waiting for a resolution and only beginning treatment then. This program has been very successful in diverting hundreds of people and resolving cases early. And we appreciate the partnership that we've had with the Public Defender's Office as part of this program. And this kind of cooperation and relationship that we had with the Public Defender's Office enabled us when COVID hit, to pretty swiftly, and working with the Probation Department and the Sheriff's Office, reduce the number of inmates in our jail by over 1,000, by approximately a third, without a significant increase in crime. Next slide, repair and healing. As we know, history doesn't stand still, and we all work and live in a society with a long legacy of inequity. It's not enough to be race blind. We need to recognize the legacy we've inherited and the future that we want to achieve. Therefore, central to our mission is the repair and healing necessary. Next slide. For instance, fines and fees, record clearance, jail and prison reduction. So we're initiating a program to eliminate fines and fees for indigent people. These fines only serve to enmesh people further in poverty. Earlier this year, we created the first cannabis record clearance project that automatically removed the convictions for marijuana offenses from all of the different local, state, and federal databases. And we're looking to expand the use of that project to all criminal convictions for which someone can have their conviction expunged after successfully completing probation. And that's thousands of cases every year. Lastly, as some are aware, we released a set of reforms that we called Bend the Arc, that were divided along 4 lines: community initiatives, internal policies and practices, robust and independent investigation of criminal police misconduct, and systemic changes. We are certainly at a crossroads, but we're blessed with an opportunity to create a more just system, a system that focuses more on accountability than merely punishment, and more on rehabilitation and public safety, as opposed to simply incarceration. We have a choice. Thank you.
Moving now to Carla Collins with Gender-Based Violence Prevention, who is our last presenter, and then the team is going to close us out with a minute on the county-wide GEAR efforts with regard to pretrial probation.
All right,
so
thank you.
Go ahead, Carla.
Okay, thank you so much. It has been an incredible and a long afternoon, so I promise to be brief. Thank you, Supervisor Ellenberg and Supervisor Wasserman for this opportunity. My name is Carla Collins, and I oversee the Office of Gender-Based Violence Prevention, part of the Division of Equity and Social Justice. And our mission is no small task. We really do plan to transform the way our county responds to domestic violence, human trafficking, and sexual assault, and to do so in partnership with all the stakeholders, the partners in the county, in the community, and especially survivors themselves. So the questions that you've been asking in the study session are really meaningful for us, because most people impacted by gender-based violence, particularly around DV and sexual assault, do not enter the criminal justice system, yet the response from the law enforcement and other partners of the criminal justice system impacts them greatly. So maybe go to the next slide. We are thankful for the longstanding partnerships between county departments, advocates, and law enforcement agencies that predate the formation of our office in last year. But we recognize that COVID-19 has exacerbated and highlighted systemic inequities among vulnerable populations, including survivors of gender-based violence. Now, as our office addresses a population quite literally that's suffering a pandemic within the pandemic, we can point to things that are working well and we need to continue to support. We work with our partners on protocols, services, prevention efforts that are focused on a collaborative cross-systems response. Our office also oversees a budget that reflects the very serious commitment from our county leaders so that we are no longer putting Band-Aids on huge gaps in direct services, but are now also investing in prevention, policy, education, outreach, and innovation so that we continue to lead the region on efforts. And a couple quick examples, piloting a strangulation response that we'll be reporting to at the board at the end of the month, to reimagining how we support families with a batterer in the court system, to creating data collection and analysis agenda that will increase transparency, common language, and common ground as we continue to strategically address these issues. And there are some things that we really need to keep working on and focus on. So maybe go to the next slide, please. Now, our office is constantly looking at what is working and what isn't. We all need to be survivor-centered and watch for unintended consequences. For example, when looking at bail reduction and early release, particularly around COVID, we also have to look at survivors' notification. Now, this is now being better addressed, but the bigger lesson is that if we aren't all asking, how does this impact survivors and families, then we are very likely failing them in the answer. And so this helps drive some of our priorities for this current year, including creating the safe space for stakeholders to do the very intentional work of really honestly examining where we need to do better. This includes looking at the co-occurrence of DV and child maltreatment and updating our protocols, moving from crisis intervention, which we always support, but also looking at root causes and long-term solutions, including more transitional and permanent housing for survivors and their families, and increasing transparency around our budget, improving data collection, centering survivors' voices, and ultimately strengthening the work to ensure better service provision to our community so that those in crisis can be safe and ultimately heal from what is really horrific traumas. So if we can go to the last slide. Again, our office is committed to ending silos around the way we address these often overlapping issues and really take a big picture look at our county as we transform the way that the county and community work together to address these issues. So I want to thank you for your time and especially for inclusion in this very important discussion.
Thank you.
Sure. And now Pratima will briefly close us out on the countywide GARE work.
Thank you, Supervisors Ellenberg and Supervisor Wasserman, because the key to this study was, is this better?
Yes.
Sorry. So because the key to the study was how are we addressing systemic racism, I wanted to close out by pointing out that the countywide Government Alliance on Race Equity Steering Committee, which was formed 7 months ago out of those of us who have had their training, has been able to roll out their...
You need to speak in the microphone through the chair.
Okay. Thank you. Sorry about that. Has been able to roll out the GARE training sessions in at least 3 of the departments that are present here. The normalize, operationalize, and organize of how we're going to do a structural racism, race equity, organization-wide assessment. Sorry about that. Okay. The assessment for organization-wide race equity has begun. There's a 3-month academic calendar for the Race Equity and Leadership 2020 Academy. Deputy Chief Mike Sims, Director Matthew Fisk, Director Javier Aguirre have already begun the work of establishing race equity teams. And as we move forward, we'll continue to report on the progress that we are making. Thank you very much.
Thank you, Pratima. We heard most of it, but maybe actually send if you wrote it down, send us what you just said, because I'm afraid that we missed some of it. I want to thank everybody, every department who really took my requests for information and engagement seriously. a tremendous number of really good, interesting recommendations were presented today. It's really fascinating to see how many of them overlap already with what the community is asking for. And it will be, I think, an exciting process to see what we can move forward in what timeline, and then what is kind of left as the outliers that I didn't hear from you today, and will we have the opportunity to talk about the feasibility of those further recommendations. Just a quick housekeeping note before I go to public comment. Yvonne Jimenez from my office is going to reach out to everyone that presented a report today with her summary, just to make sure that she got it all accurately, that we're reflecting what you want us to reflect, and that will be included in the report. I'm going to go now to public comment and then wrap up. I had just questions for two of the speakers, and I'll see what my colleague has. And Frank, can you tell us how many speakers there are on this item, please?
We currently have 6 speakers in queue. 7 now.
7.
Yes.
Okay, I think if we are staying under 10, of course, I don't know if one of them, again, will have 5 or 6 speakers on the phone. All right, we'll go with 2 minutes. And how about by the 3rd speaker, Frank, let's cut off whoever is the last person to join the queue. By the time we're on the 3rd, will be the last speaker.
That works. Thank you.
Okay, thank you.
The next speaker is Scott Largent. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon, everyone. Scott Largent. You know, getting feedback, excuse me, from all the different department heads is important, but, you know, I really think we need more input from the public. I think maybe someday we could get some more people on a panel, you know, that can come forward and really discuss what's going on. I listened to the behavioral health department and what they were talking about, and actively getting, you know, people from the community involved that were previously homeless, previously drug addicts, you know, life experience. Now, the current employees that are working there that I film and follow when they, you know, do these stops, I think they're qualified, and you guys are going to get butthurt that I'm saying this. I think they're qualified if they're going out to San Jose State, maybe going to a sorority to help a girl that's upset about a broken fingernail. They are not qualified. They just don't have that experience. And I watch this constantly crash and burn. I watch the gal come out there with the backpack, the clipboard. You know, she doesn't have anything in common with these people. And that's what's frustrating right now. I'm out there on the streets daily interacting with people. I'm trying to do the best I can do. There's a lot of other homeless advocates that are out there. They understand the streets. They know what's going on. They know what needs to be done. But the system fights that. You don't want to hear it from a member of the public that it doesn't work. Now, we finally had Tony Tolis kick rocks, but what we did is we praised failure. We kind of gave her that, you know, golden parachute on the way out, and every one of you just said she did a fantastic job. That's not the feedback that I've gotten from a lot of the public, other department heads, but you know, we want to pin 15th place medals on people here in Santa Clara County. I'm going to keep saying it. It doesn't work. And so I've just listened.
The next speaker is Debug Community. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, this is Jose Valle with Silicon Valley Debug. At Debug, we are met with concerns from family members and their loved ones. Over the years, we have supported and amplified the voice of the incarcerated who annually went on a hunger strike for the past 3 years, addressing inhumane conditions due to solitary confinement and classification, which led to the Chavez and Santa Clara County consent decree that's currently in place. Today, we stand in support with the same population who, due to their incarceration and culture of the district attorney's office, are not able to join in the protests on the outside movement of Black Lives Matters and the unjust murder of George Floyd. I appreciate the district attorney's attempt to make a change and has been the ARC reforms, but frankly, most of those efforts are already in place and already in motion. His view of Latino males from impoverished communities is not acceptable, and simply his reforms are not enough. The incarcerated are the most impacted by mass incarceration, police brutality, and for that reason, we applaud their courage in the form of a hunger strike to be in solidarity with the current movement. Their goals in brief are to bring attention to the issues of Black Lives Matter and the murder of George Floyd as it relates to them, as there is no party that is more responsible for mass incarceration and police brutality in our county than our district attorney's office. Number one is the racist gang enhancements and 3 strikes law. Number 2, the urgency of the sheriff to agree with the Oakland office so they could begin investigations in the jail. And number 3 issue that they would like to bring attention to is the issue of police brutality. The hunger strike begins on August 14th. Thank you.
The next speaker is Robert Aguirre. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking.
Robert Aguirre here. Listen, I listened to several, actually all the reviews, and the one from behavioral health, it's wonderful that they're going to put together this outreach, and I don't know if it's going to be a mobile van or how they're going to go about doing it. But let me tell you, if you have a closet full of shoes and you go shopping for more shoes and you have no place to put those new shoes, you're either going to throw out the old shoes and put the new ones in there, or you're going to have to build a bigger closet. So what we've got here is a bunch of people going out and finding people that require mental care, but we don't have enough beds. Okay, that's a real basic thing, that if we don't have a place to put people, then it makes it real difficult to provide treatment. All you're going to do is triage and let people go, and it's a circular system. They can't get out of it. And one of the comments that I want to make, Jeff Rosen had made about we want jails to be a place for people that we fear. Well, that's one of the things that African Americans have been talking about with Black Lives Matter, because they get singled out. They get picked up to be searched and held up against a wall and arrested and that sort of thing. And people fear them. You have a Black person in a white neighborhood and people fear that Black person. So it's not about people that are scared. We shouldn't be putting people in jail because we're scared of them. We should be putting people in jail because they are an actual threat. And I think we need to change that vocabulary real quick before that gets out, because I certainly don't want the jails to be a place where we put people that we're afraid of. And then back to behavioral health, I think a lot of people are also afraid of people that have behavioral health issues. And we need to educate the public that this is an illness. It's not a crime. Just like unhoused people, being unhoused is not a crime, but yet people call in about people that are moving in, putting in tents or spreading trash.
The next speaker is M. Horst. I am unmuting you. Please accept the unmute and you have 2 minutes to speak. The timer will start when you begin speaking.
Hello, and thank you. I'm M. Horst, a transgender woman, a resident and voter in unincorporated Santa Clara County, and a PhD student, researcher, teacher, and employee at Stanford University. Following the last community engagement session on law enforcement, a coalition of Stanford organizations representing several thousand people submitted public comments on July 31st. This was motivated by concerns about pervasive discrimination by Stanford police against Black, Latinx, Indigenous, and trans students and community members. I'm here as one of those several thousand because I really wanted to highlight those concerns. Because of the unique nature of the policing agreement between the county and the university, Stanford has a hybrid public-private police force with little to no accountability or oversight of actual power. This is both dangerous for campus residents and for citizens of nearby Santa Clara County, and it establishes a dangerous precedent for private entities funding and controlling public police, which we've started to see in San Mateo County with an agreement between Facebook and Menlo Park. With all due respect to Supervisor Wasserman, we just saw police who were on a phone call with their bosses and with public health officials, sheriffs rather, who were not respecting social distancing and who were removing their masks in a room nearby other people. What happens when they're not on a call with their bosses? So this is a major concern. We're grateful that the county is approving the referral for 8 Can't Wait, but we really think that 8 to abolition policies are absolutely needed. So I just wanted to take the time to start a conversation about policing on and around campus, urging disclosure of policies on force, ethical behavior, commitment to de-escalation techniques, and eventual dismissal and disarmament of police officers deputized at Stanford campus with diversion of money towards non-carceral municipal services. I think we've heard some great ideas for what those services could look like.
The next speaker is B. Beekman. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking.
Hello, thank you. I think there is a City of San Jose housing meeting tonight on how to work with new HUD ideas in a now COVID-19 world. These good ideas of mixed income housing are the same. The good ideas of mixed income housing are the same pre and post COVID-19. Please don't let conservative fears control agreed upon good mixed income ideas of positive sustainability in housing. I hope that can help a bit. And I have another few words about, I hope we can have an open discussion in the next few months of 60+ shot spotter speakers spaced 5 feet apart at the new Berryessa BART station. Good minimal use practices would suggest 5 to 15 shot spotter eavesdropper technology speakers would accomplish about the same thing in the area and should still serve as a deterrence element you were looking for. Meanwhile, with the world that is possible from everyone coming down from on high at this time, gun use at Berryessa and North San Jose may be rare and infrequent in the future, making its wall of eavesdropping technology possibly overindulgent and overreactive. I think it's a good example of how we just need to shift our thinking, and we just, whatever you think of things, try to shift it and think what can be a more proactive community approach with everything you do. And something will just surprisingly appear to yourself that's incredibly beautiful. With 23 seconds to comment on a District Attorney Rosen's words, Black Lives Matter, I think they're teaching everyone in the community not to go into the jail system. They're doing the efforts to be fearful of what the jail system represents. You don't have to create your own fears and intimidation about it. Thank you.
The next speaker is Elisa Koff Ginsburg. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon. I'm Elisa Koff Ginsburg with the Behavioral Health Contractors Association. Thank you, supervisors, for your committee's consideration of these critical issues. And thank you, Supervisor Ellenberg, for your very comprehensive and thoughtful report. We're grateful to have our recommendations included. Today, I want to offer a slightly different reflection. The pandemic has necessitated the release of people who would not otherwise have been released and lowered the population in the jail, as we heard this afternoon, by 1,000 without increase in crime. This provides an opportunity to reassess our larger approach. While it is necessary to improve the conditions for those who need to be incarcerated and require behavioral health services, we have to be clear on the scope that is required. The strong teamwork that Mr. Fisk pointed to earlier have allowed us to work on how to best provide mental health and substance use care to this population outside of the jail facility. One of the most famous movie lines is, "If you build it, they will come." Santa Clara County has the opportunity to build upon and expand community-based services at this time. And the first step in doing that is to reevaluate the plans for a new jail. Thank you.
The next speaker is David Mineta. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking. Hello, David. Okay, we'll go on to the next speaker. Next speaker is Victor Vasquez. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking.
Hello, thank you so much. My name is Victor Vasquez and I work at Somos Mayfair. I'm here representing the Si Se Puede Collective as well. We would like to thank the committee, the listening sessions provided by Supervisor Ellenberg for making them public and as a good way of actually getting community voice. There's several policies that we felt like connected to what we felt would support and increase public safety, the commitment to any school to prison pipeline by removing police officers and police programs, reinvesting in neighborhood programs, parks, well-lit infrastructure, sideways, parks in general, investing in after-school programs for young people, ending digital divides, pro-social activities, the list goes on. Childcare, opportunities for childcare and early education opportunities, and also creating civil engagement, right? Providing the opportunity for folks who don't have the right to vote, whether it's undocumented or otherwise, or felons, and standing behind that. In general too, just wanted to highlight that as part of creating a stabilized community and supporting people who are impacted by incarceration or who want to create safety is to think about housing. In the report, there was a lot of mentions around housing, affordable housing, maybe think about cooperative housing as a way to address long-term systematic exclusion, long-term systematic systems of creating poverty that lead into crime or those kinds of behaviors. And so just want to highlight that and for us to think about that these systems are connected. As somebody comes out of incarceration, they will need a place to stay, a place that they can afford, a place that they can survive as we provide wraparound services. On the prevention side, when you have a place where people can live, where they don't have to move around or feel displaced, that's affordable, people can actually think about, they don't have to make life choices like, should I go to college? Should I get a job? Should I continue education? Or should I commit a crime? Think about housing as well.
The next speaker is Raj Jaidev. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking.
Yeah, I want to thank Supervisor Ellenberg for this question as an invitation for our county to be part of this transformative moment we're in. And I also want to acknowledge the agency leaders of how difficult of a task that I believe she put you into, which was how do you do a PowerPoint on dismantling systemic racism? Because this is clearly not a moment about trying to make systemic racism kinder or gentler. This is about boldly reimagining justice and dismantling those institutions of systemic racism. So as such, it's not so much about a new program, about a budget cycle. This is an ancestral struggle, a legacy of slavery. And so I wanted to offer a different frame. And that is for all of these agents that we've talked about to be thought of as extensions of the criminal punishment system that isn't necessarily just about trying to fine tune or address mildly systemic racism, but that they are actually manifestations, institutions themselves of that legacy of systemic racism. And so if that's the case, the goal then is to shrink their imprint, for these agencies to humbly concede ground to the community to determine what justice and accountability may mean when they're not occupying the space. And so I believe the exercise that we're embarking on is about certainly deconstructing the mechanisms and apparatus of systemic racism to allow space for us to construct, to build, to imagine. And with that, I hope you get a chance to read our contribution to the report, because it is the people themselves who have been incarcerated, whose loved ones were killed by police, that have taken the courageous step of imagining what this world could look like without the criminal punishment system and re-articulating what justice can mean in Santa Clara County. Thank you.
Going back to David Manetta, you're the final speaker. I am unmuting you. You'll have 2 minutes to speak. The timer will start when you begin speaking. Hello, David.
Hello. Hi, thank you. Sorry about that. Good afternoon, supervisors, county administration, and department heads. It's always difficult to go after Raj, so bear with me. My name is David Mineta. I'm the CEO of Momentum for Health and also the president of the Behavioral Health Contractors Association. And I just wanted to actually discuss sort of how the racial and equity issues at the very core of how Supervisor Ellenberg opened up the meeting today are at the core of this discussion around kind of looking at alternatives to law enforcement only responses to behavioral health calls, and not wanting to treat behavioral health issues in the community, these are health conditions, as sort of a criminal response by law enforcement. And in this way, BHCA has a work group on alternative models, and we have done research on community-based models, and the CAHOOTS model from Oregon, Eugene, Oregon has come to the fore. We're currently doing interviews with 7 different cities across the country. One factor that repeats is the reluctance by community members to call 911 for fear of a negative outcome. Some communities distrust of not just police, but of government at all. And one aspect of the cities that we've interviewed so far is that they are creating response teams that are run by community organizations. After we're done with the interviews, we will update the paper you have, and we look forward to continued discussions with the county on this important issue. Thank you very much.
This concludes the public speakers, Madam Chair.
Thank you. Thank the public speakers very much for weighing in. Throughout this conversation, I've been jotting down question after question, and I can see the panic already in Supervisor Wasserman's eyes. I'm going to ask just 2 on the record, and the rest I'll send and follow up with the departments. My first question is to the Sheriff's Office. Can I get an update, please, on the status of the OCLEM agreement? Has the Sheriff signed it? The MOU.
Hi, Supervisor Ellenberg. This is Under Sheriff Rick Sung again. My understanding is that the Sheriff had asked several questions to County Counsel to get their input on that, but I haven't received any latest update on it after that, and it's been a few weeks. So we'll check back with County Counsel on the status, and we'll advise.
Let's do that right now. Is there someone from County Counsel who can address that?
Yeah, Supervisor Ellenberg, Rob Coelho here, Assistant
Thanks,
County
Rob.
Counsel. I spoke with the attorney that's doing the work within our office for OCLEM. Both the OIR group and the Sheriff's Office have provided input on the draft, and the attorney for OCLEM is working with James Williams on the comments that it received both from the OIR group and the Sheriff's Office. I do not have an estimate from James as to when the review of comments from both the contractor and the sheriff will be resolved, but issues were raised by both the contractor and the sheriff.
So until that MOU is signed, the oversight cannot begin. So
actually, Supervisor Ellenberg, we've already been working with OIR and have provided a lot of information for them to start looking into with regards to policies, our procedures, and some of the reports that they asked for that we have provided to them. And they're also in the process of setting up a community meeting as well. So the work is still ongoing. It's just that the sharing data agreement portion is being worked on.
Got it, and thank you for clarifying that for me. Of course, the shared data is a really critical part of a useful oversight operation and an impactful working relationship. I'd like to be included in the community meeting, or at least notified of it. I or someone on my team would like to listen to that. And Rob, if I could ask you to circle with James and as soon as possible, get an estimate on when we can expect this MOU to be signed, please.
I will do so.
Thank you. My other question is for the behavioral health team members. I'd like to get an off-agenda report on alternative classifications for the PERT and mobile crisis teams. Specifically, do the responders need to be clinicians? I've gotten lots of feedback from community-based organizations that peer model or some not as advanced degree of professionalism is necessarily essential to being able to usefully fill this role. And I'd like that report back to include an analysis of a peer response model. And also, if there's any data that indicates whether this is a little bit separate from the PERT teams, this is really more about the crisis intervention teams, but I'd also like to know crisis intervention training. If there's any data that indicates whether departments are seeing better outcomes with dedicated CIT teams like the Memphis model versus when the whole department receives some CIT training. So the question there is, does behavioral health see some value in having a dedicated crisis team? So I will leave the questions there. We will follow up with all of you. We will continue marching forward with this initiative. And once again, I appreciate all of your support. And Supervisor Wasserman, do you have any other comments or questions?
Thank you. I'll make mine very brief. I want to thank DA Rosen for mentioning in his comments the importance of education. Education to me, over my 18 years in office, has always been a cornerstone of every community, be it safety purposes, property values, domestic violence, safety, crime, etc., gang activity. There's always a direct connection that I've found between schools and education and kids that receive education and go to school and staying out of our jails and not getting into trouble and being able to have a happier and successful life. So I thank you, DA Rosen, for that. I did have one question through the chair for our DA, if I may.
Of course.
And that is specifically, you talked about prosecuting, you talked about charges, you talked about arrested. I know there's slight distinctions between each of those type of things, but do you happen to have what is the ethnic breakdown? You mentioned 10,000 people roughly diverted, DA Rosen, from going to jail. And I wondered if you had a ethnic breakdown as to the ethnicity of those people diverted and how that compared to the ethnicity of those people charged.
I can get the specific demographic breakdown of people.
If you could off agenda, that would be great.
I will. I will absolutely do that. And I can tell you that it's going to be somewhat near the demographics of who we prosecute and charge, but okay. I don't know if it'll be exactly the same, but I'm pretty confident that it will be close, but I'll certainly get that information to you and to Supervisor Ellenberg.
Thank you. That was my assumption as well, but I just wanted to get confirmation of that because I know we're looking for inequalities in various areas. I know it's very tough when people are brought in, you know, you look at the facts, decide who to charge, who not to charge, what to charge, and go forward from there. So I just wanted that last piece. I think everything else you've tied in very well. I do want to acknowledge that I read the entire 70-page Ellenberg report, as well as while I browsed through the 95 pages of attached public comments. I wanted to thank Supervisor Ellenberg for taking this on, all the work that her staff has put in. The meeting today has been very informative for me. What I read was very informative. It was a great report, very extensive. And I'm also very, very, very proud of each and every person on the county team for what you have been doing these last few years. I've been here for 8 years. I got here during the Great Recession. I got here when things started up with the jails, all pre-Michael Tyree, various designs in the jails, increased mental health, the issues we had with a couple of different organizations, the 600 or 800 recommendations that we agreed to make, all the things that we've been making since then, all the advancements and steps that each and every one of you in your respective departments has taken over the years to make us so much better than when I got here. Am I saying we're perfect? No. Are we ever going to be perfect? No. Is anybody perfect? No. Are we damn good? Yes. Yes, we are. And is there room for improvement? Sure there is. There's improvement in everybody's lives everywhere. But what you're doing, and for me to be on the Board of Supervisors for this system that deals with justice and incarceration and prosecution and defense and probation and anything else that I left out, you are awesome. And I am proud of each and every one of you. I defend each and every one of you and your departments anytime I'm asked at any public meeting. It is so much easier for people to criticize. And I've always said it's the people who aren't happy with something for whatever reason are the ones who write or call or show up to speak. And 99% of the people and emails that we get are negative. But I can guarantee each and every one of you, the overwhelming thought out in the community is that we are doing a very good job with a very difficult situation. And we're getting better every day. And each of you clearly cares about your job. You clearly are passionate. There's no time clock punchers among you. You really, really care about the people you work with, the people you serve, the people that you care for in whatever respect that may be. And I'm really, really proud. And Supervisor Ellenberg, at the end of your report, on your page 7, you mentioned plans to seek support for the creation of a committee to reimagine public safety and justice. You and I, we'll see how that plays out more in further discussions. You and I may disagree with how we get to what it is you want to do to further enhance the complex and comprehensive and phenomenal system I believe is already in place. But I would love to find a way to do what we all agree needs to be done within our existing framework, rather than creating another committee, another entity, another organization of some sort, requiring more personnel or anything else. I think we have the people here, the will and the desire to do what needs to be done. And I'm proud to be associated with all of you. Thank you, Madam Chair.
Thanks, Mike. Yes, as usual, we have areas of agreement, areas of disagreement. What I'm hearing from the community is that they want a voice, and we can't replace community voice no matter how skilled or qualified our professionals and our staff is. It's still an internal operation. There's a lot of interest in bringing far more voices and a broader range of experience to the table. I appreciate that you noted that none of our folks here are time clock punchers. However, it is 5:22. And I do want to be very respectful of the additional hour and 22 minutes that everyone has already given beyond our normally scheduled meeting times. There is lots more to come on this action moving forward. But unless you've got any other final comments, Supervisor, I would be happy to adjourn this meeting.
Thank you. I do have a further comment in response to what you said.
Go for it.
With all respect, this whole transformation, this whole everything was beginning when I got here 8 or 9 years ago. And there have been hundreds of meetings and tens of thousands of emails and thousands of speakers. And then we still got into a whole issue with a company I won't even name that resulted in 5, 6, maybe the sheriff's department could tell me 700 agreed upon modifications to our system. And like I said, we can always do better, but we have heard from thousands, if not tens of thousands of people over the last several years, and that will continue no matter what we do. I'm just suggesting, and I was just referring to that one sentence in the
Oh, I understand. Mhm.
I was just referring to that and the possibility. There's often several different ways of getting to the same place, and I was just suggesting another way.
Understand and heard and appreciated. I neglected to ask if there were any announcements before hastily calling for an adjournment. Do any of the members have any announcements for the good of the order? And if I'm not seeing you, please just interrupt me and begin speaking. I don't see any.
Did I mention my 99-year-old mother's friend recovered from COVID? Yes, I did.
You did announce that.
Yeah.
All right. In the absence of seeing any announcements, I will adjourn our meeting to September 2nd, 2020. September 2nd, 2020 at 2 p.m. That's a lot of twos. Very likely right here on Zoom. Take care, everyone, and thank you again very much for your time and your thoughtful
See everyone
input.
then. Bye.
Bye.
Thank you.
Thank you.
All right, cool. Thank you, Frank and Jill and Yvonne. I'm out.
Thank you.
Thank you,
All right, have a good
Supervisor.
night.
Have a good afternoon.
You
Bye-bye.
too.
Thank you, Frank.
Thank you. Have a good one.